Mohon izin, ini bisa saya buka untuk Watendi bisa masuk.
It's better take a photo first time. Eh? Maybe take a photo by Juliana, anak di Ana. First time, for the first time.
Oh, okay.
Yes.
So let's take a picture first for all documentations. Okay, be ready. 1, 2, 3, smile. Okay, one more time. Okay, thank you.
Thank you very much.
Thank you, Dr.
You're welcome.
Lecturer and student.
Don't be confused with the pictures I send to you. It's Earth, but it's our Earth. But by the time you see this, our Earth will be long gone, replaced by your Earth, horrible Earth. And to you, the future generations, we are deeply sorry about that. So many beautiful things that we have now, and all good things that nature has granted to us that you won't be able to have, to see, you won't be able to touch. Sorry, we have polluted your air for a long time. Sorry for our production and consumption habit bring damage to your earth. Sorry that we can't stop ruining the oceans, the forests, and the soil. Sorry for the carbon dioxide we kept releasing. We see the signs, but we decide to do something else in the name of civilizations. We forget what's good of that if there will be no future. No such thing what to call a civilization. We are sorry for stealing your future. Above all, we are sorry that the whole world can do enough to give you a beautiful and safe planet that you can call home. We feel on our responsibility, but you can still save your future for your children. I give you the seeds, plant them one by one until it clears your air, your atmosphere, restore the climate. Dear children of the future, you can still save the earth. Don't wait, act now. And once again, we are deeply sorry. Do not repeat our mistake.
Airlangga University is one of the most famous universities in Indonesia, located in Surabaya, East Java. One of the most favorite faculty in Airlangga University is Faculty of Veterinary Medicine. Faculty of Veterinary Medicine in Airlangga University is the best of its kind in East Java and reputable in Indonesia. In order to reach its visions expected by the whole civitas academic of Airlangga University, veterinary faculty conducted academic education, profession, specialists in veterinary field, and also animal husbandry based on modern education technology, which are able to spawn alumnus with professional skills and have strong willingness to develop their knowledge. Faculty of Veterinary Medicine keeps on showing its existence, proven by many accreditations from various accrediting agencies, both in educational and laboratory. Faculty of Veterinary Medicine in Airlangga University always try to be a pioneer of development in education and research regarding veterinary field and animal husbandry, which is independent and innovative, based in religion morale, ethic, life environment preservation, and animal prosperity by keep orientating in society prosperity. The previously mentioned facts show that veterinary faculty of Erlangen University had already become one of the most favorite university in both national and international levels. There are 9 departments in Faculty of Veterinary Medicine in Erlangen University. They are Veterinary Anatomy Department. It provides learning process regarding structures and normal function knowledge, names and layout of body compiler in microscopic and macroscopic stages of domestic animal, along with comparison, beginning with embryonal up to grown form. Veterinary Basic Medicine Department, a department which is facilitating about fundamental knowledge in basic veterinary medicine in support of disease diagnosing before applying further anticipation in a health treatment, and also provides basic knowledge in veterinary product development. Animal Husbandry Department. It learns about every aspect of animal husbandry, started from the types of poultry, maintenance system, housekeeping, animal husbandry waste processing, feed formulation and engineering, economical productivity and values, up to utilization and development of probiotic product. Veterinary Microbiology Department provides learning about bacteriology knowledge, mycology, biology and immunology, also microbiologic diagnostic techniques. Veterinary Parasitology Department. The department learns of the kind of parasite characteristic in livestock animals, pets and wild animals, which divided into zoonosis and non-zoonosis covering morphology, species characteristic, wet nurse, predilection, life cycle and infection mechanism observed from economy and health point of views. Also provides comprehension concerning on parasite protein exploration in animals. Veterinary Pathology Department. It educates regarding disease starting from disease causes, pathogenesis, clinical indication and a number of lesion forms microscopically and macroscopically in cells or system which are having lesion, classification and pigmentation, hemodynamic interference, inflammation reaction and recovery mechanism, cells adaptation, development of interference and neoplasia, which are caused by whether infectious or non-infectious agent. Veterinary Reproduction Department. Fundamentally, the materials given by the department concerning on reproduction system, physiologic system, applied reproduction technology to improve reproduction efficiency and preservation, maternity diagnosis and pathology, parturition and its complication, infertility and sterility aspect, also reproduction health treatment. Veterinary Public Health Department. Subjects provided in this department such as public health veterinary, feed secureness warranty system, veterinary legislation, zoonosis, environment health and veterinary epidemiology and economy. Veterinary Clinic Department. This department provides subjects which categorize in veterinary clinic science, covering clinical diagnosis, internal disease science of large animals, general surgery science, experimental animals management, internal disease science of small animals, special surgery science and radiology. Faculty of Veterinary Medicine has various facilities in support of students' academic activities, which are useful for innovative and high-quality basic research activity. Library. Veterinary Examination and Feed Analysis Unit. Frozen Semen Production Unit. Animal Hospital. Beside academic activities, Faculty of Veterinary Medicine students also actively in charge in many academic activity throughout various students' organizations. The lecturers and teaching staff also no less active in some of veterinary department programs.
Next, 今後も一緒に、世界の寄生虫について一緒に研究できたらとても嬉しいです。アイルランガの皆さん、今後も一緒にやっていきましょう。Efkaha Unne Success!
In each achievement, veterinary department also had its hands in donating works in form of research development and authorized product. Faculty of Veterinary Medicine in Airlangga University always try to be a pioneer of development in education and research regarding veterinary field and animal husbandry, which is independent and innovative, based in religion morale, ethic, life environment preservation, and animal prosperity by keep orientating in society prosperity.
Fakultas Kedokteran Hewan Universitas Airlangga ke depan, kita ingin menyediakan sarana prasarana pendidikan, mulai dari rumah sakit hewan, teaching farm, teaching hospital, dan lain sebagainya, yang diharapkan banyak memberikan kontribusi positif kepada perkembangan anak bangsa ini untuk menjadikan dokter hewan yang tangguh dan bermanfaat bagi masyarakat Indonesia.
Manusia Mriga Satwa Sewaka, prospering human through animals. Veterinarians have their roles in improving humans' prosperity, from dealing with zoonosis diseases.
Ladies and gentlemen, may I have your attention please? Our event is about to begin. Please kindly remain online and thank you very much for preparing yourself to join in our event. Assalamualaikum warahmatullahi wabarakatuh. Good morning to all the participants. The Honorable Dean of Faculty of Veterinary Medicine, Airlangga University, Professor Dr. Mirni Lamid, Doctor of Veterinary Medicine, Master of Agriculture. The Honorable Vice Dean Faculty of Veterinary Medicine, Airlangga University, Dr. Primayanti, Doctor of Veterinary Medicine, Master of Health. Professor Dr. Sri Hidana, Master of Science, Dr. Iwan Syahrial Hamid, Doctor of Veterinary Medicine, Master of Science. The Honorable our speakers, Dr. Sirinan Pisamai, Doctor of Veterinary Medicine, Doctor of Philosophy from Department of Surgery, Faculty of Veterinary Science, Chulalongkorn University, Thailand. The Honorable Professor Dr. Muhammad Lazuardi, Doctor of Veterinary Medicine, Master of Pharmacy from Department of Basic Veterinary Medicine, Faculty of Veterinary Medicine, Airlangga University, Indonesia. The Honorable Professor Muhammad Zamri Saad, Doctor of Veterinary Medicine, Doctor of Philosophy from Department of Veterinary Laboratory Diagnosis, Faculty of Veterinary Medicine, University Putra Malaysia, Malaysia. The Honorable Professor Dr. Mitsuru Tagagi, Doctor of Veterinary Medicine, Doctor of Philosophy from Laboratory of Theriogenology, Joint Faculty of Veterinary Medicine, Yamaguchi University, Japan. The Honorable all lecturers and all the participants of this event. First of all, let us pray and praise to Allah Subhanahu wa Ta'ala. Because of His bless and mercy, we can come together without any obstacle with healthy condition in this event. I'm very pleased to see you here, and it is our pleasure to welcome you to our international webinar event, proudly organized by Faculty of Veterinary Medicine, Airlangga University. My name is Dian Ayu Permatasari, the Master of Ceremony of today's event. Ladies and gentlemen, before we start the event, let me share the agenda of this event. We have several agendas are as follows. The first agenda is opening. The second agenda is opening remark by Chairman, Dr. Suryo Kunchoro Jakti, Doctor of Veterinary Medicine, Master of Veterinary, Doctor of Philosophy. The third agenda is opening speech from the Dean of Faculty of Veterinary Medicine, Airlangga University, Professor Dr. Mirni Lamit, Doctor of Veterinary Medicine, Master of Agriculture. The fourth agenda is presentation from the speakers. In the plenary session 1, the first presentation will be delivered by first speaker, Dr. Sirinan Pisamai, Doctor of Veterinary Medicine, Doctor of Philosophy. The second presentation will be delivered by second speaker, Professor Dr. Muhammad Lazuardi, Doctor of Veterinary Medicine, Master of Pharmacy. In the plenary session 2, the first presentation will be delivered by first speaker, Professor Muhammad Zamri Saad, Doctor of Veterinary Medicine, Doctor of Philosophy. The second presentation will be delivered by second speaker, Professor Dr. Mitsuru Takagi, Doctor of Veterinary Medicine, Doctor of Philosophy. The fifth agenda is closing remark by Vice Dean in Academic Student and Alumni Affair, Dr. Rimayanti, Doctor of Veterinary Medicine, Master of Health. And the last agenda is closing. Ladies and gentlemen, the first agenda is opening. Let's start this agenda by praying according to the respective religion and belief. Okay, let's pray together. Pray begins. Pray finish. Thank you very much. And the second agenda is opening remark that will be delivered by Dr. Suryo Kunchoro Jakti, Doctor of Veterinary Medicine, Master of Veterinary, and Doctor of Philosophy. As a chairman in this event, to Dr. Suryo, the time is yours.
Okay, thank you. Good mornings. Assalamualaikum warahmatullahi wabarakatuh. The Honorable Dean and Vice Dean of the Faculty of Veterinary Medicine, Universitas Airlangga, the Honorable, our distinguished speakers, the Honorable lecturers from Universitas Airlangga, and other abroad university who join this event. All students and all participants, well, welcome to everyone. On behalf of the committee of the international webinar, I would like to thank to all of you for joining today's event. This event couldn't work well and smooth without the help from all of the committee who has worked hard during these couple weeks. Thanks for your hard work. The theme of today's seminar is a current update on veterinary science from the bench to clinical application. As we know that the progression of veterinary science development nowadays is very massive and very rapid. By this event, we do hope that we can get a new knowledge from the speakers, and we also want to extend a note thanks to our special guest, Dr. Sirinan Pisamai, Doctor of Veterinary Medicine, Doctor of Philosophy, Professor Dr. Muhammad Lazuardi, Professor Muhammad Zamri Saad, and Professor Takagi for accepting our invitation and joining with us this morning's event. Welcome to the event in Faculty of Veterinary Science, Universitas Airlangga. For your information, our today's meeting, as more than 500 participants have been registered and will join this event. They came from at least 14 different countries: Indonesia, Malaysia, Thailand, the Philippines, Myanmar, Japan, Sri Lanka, India, China, Kazakhstan, Uzbekistan, Nigeria, and the United States. And finally, we do hope all of you could follow the programs by please savor, and it will be beneficial for us. Enjoy this program and thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, Dr. Suryo, for the opening remark. So we come to the third agenda, which is opening speech from Dean of Faculty of Veterinary Medicine, Airlangga University, Professor Dr. Mirni Lamid, Doctor of Veterinary Medicine, Master of Agriculture. To Professor Dr. Mirni Lamid, the time is yours.
Bismillahirrahmanirrahim. Thank you, Dr. Tian. Good morning. Assalamualaikum warahmatullahi wabarakatuh. The Honorable distinguished guests, lecturers, and students. Warm welcome to everyone. First of all, I will introduce myself. I'm Professor Dr. Mirni Lamid, DVM, Magister Agriculture, as the Dean Faculty of Veterinary Medicine, Universitas Airlangga. On behalf of our faculty, I extend a very sincere warm welcome to all of you present here on the special occasion in international webinar with the theme Current Update on Veterinary Science from the Bench to Clinical Application. And also want to extend a note of thank you to our special guest, Dr. Sirinum Pisamai, DVM PhD. Nice to meet you. Dr. Sirinum, I will say thank you for your university that my lecturer, Dr. Suryo Kunchoro Jati, have been finished PhD in your university. Thank you. And I have already go to your university on the 2017. It's very nice university, I think. And thank you, Professor Dr. Muhammad Laswardi, DVM, Magister Pharmacy. He is our lecturer. He is expert in the pharmacy. And thank you for Professor Muhammad Zamri Saad, DVM, PhD. I would like to say thank you, Prof. Muhammad Zamri Saad, that my student, my lecturer, Dr. Juliana Puspita Sari, have already finished a PhD in UPM, University Putra Malaysia. I have already go to your university, and on 2019, I think, yeah, yesterday, last year, I think last year I go to your university. And thank you for Professor Mitsuhiro Takaki, DVM PhD. I would like to say thank you for you that too. Our lecturer now is study in your university, Dr. Oki and Dr. Lita, for accepting our invitation and joining with us this morning's event. Welcome to the event in Faculty of Veterinary Medicine, Universitas Airlangga. The city, which have specific icon or symbol, Sura, it means sock, and Baya, it means crocodile. In this special event, we invite world-class professors from top veterinary school in Asia to share their knowledge regarding the latest updates, sciences related in veterinary science, both in basic science to clinical practice. Through this event, in the pandemic era, where we couldn't meet directly, but by using technology, we still can make our today's event work well and smooth. We do hope by this event we can extend and strengthen our collaboration for the developing veterinary science field in the region between our faculty, our university, with your university. We do hope all of you could follow the programs by please server, and it will be beneficial for us. And especially I will say thank you for all participants. It's very, very, very important, and I very, very thank you the participant from Indonesia and from the, I think from the Malaysia, Thailand, Philippines, Myanmar, Japan, Sri Lanka, India, China, Kazakhstan, Uzbekistan, Nigeria, and America. Thank you very much for your participation. Thank you all the committee who have prepared and conducted this webinar this morning. And again, thank you for all of you. Wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, Professor Dr. Mirni Lamid, for the opening speech. So the next agenda is the main agenda, which is we are waiting for presentation from the speakers. For the plenary session 1 will be guided by our moderator, Dr. Aditya Yudana, Doctor of Veterinary Medicine, Master of Science. Before we start the plenary session 1, I would like to read briefly about the curriculum vitae of Dr. Aditya. So Dr. Aditya is one of the lecturer in Department of Veterinary Parasitology, Faculty of Veterinary Medicine, Airlangga University. In 2012, he has received his Doctor of Veterinary Medicine at Faculty of Veterinary Medicine, Airlangga University. And in 2014, he got his Master of Science in Disease Science and Veterinary Public Health at Faculty of Veterinary Medicine, Airlangga University. And for publication, he has published 5 papers, Capus Index, 30 citations, 7 national papers, and 5 community empowerment programs. Okay, that is the curriculum vitae from Dr. Aditya. And please welcome to Dr. Aditya.
Okay, thank you, Dr. Dian Ayu, for the introduction. Good morning, everyone. Assalamualaikum warahmatullahi wabarakatuh. Hope you are fine and safe during the uncertain pandemic situation. Ladies and gentlemen, let me introduce myself. My name is Aditya Yudana, and I will be guiding the first plenary session in this international webinar. Also, personally, I would like to say thank you to all of you for attending and welcome to this international webinar, which conducted by Faculty of Veterinary Medicine, Universitas Airlangga, with main theme current update in veterinary science from the bench to clinical application. So before we get started, I would like to inform several points to all of you so you know how to participate in today's international webinar. You have joined the presentation by using your own device, phone, tablet, computer, etc. in attendee default setting. You will not be able to use or activate the video or unmute the microphone feeder until we allowed you to do so. The virtual room setting will just allow you to see and hear the moderator and also the lecture from the speakers only. Moreover, in your control panel, where located below the screen, you will have chat icon and also Q&A icon for general question related with this session. Please drop your question or any other statement in chat box. However, for question related with the lecture, please drop into the Q&A box. All of participants will have the opportunity to typing question which relate to speaker subject and submit in Q&A which available in the control panel. Also, you may allow submitting your question at any time during the presentation and we will collect also address at the end of the presentation. Okay, for the first plenary session, we already have 2 honorable and remarkable speakers, and I think all of you already familiar with the speakers. The first one, I will mention Dr. Sirinun Pisamai, Doctor of Veterinary Medicine, Doctor of Philosophy. She comes from Department of Surgery, Faculty of Veterinary Science, Chulalongkorn University, Thailand. And our second speaker, Professor Dr. Muhammad Lazuardi, Doctor of Veterinary Medicine, Master of Pharmacy. He comes from Department of Basic Veterinary Medicine, Faculty of Veterinary Medicine, Universitas Airlangga, Indonesia. Okay, in order to shorten the time, let we start the first presentation. And now I would like to introduce our first speaker. She is Dr. Sirinun Pisamai, Doctor of Veterinary Medicine, Doctor of Philosophy. She is a lecturer at Department of Surgery, Faculty of Veterinary Science, Chulalongkorn University, Thailand. As you can see in screen, Dr. Sirinun also have expertise in molecular biochemistry, genetic engineering, and also biotechnology. In addition, she is also directly involved in academic activities such as conducting research project regarding gene expression, proteomics, and also transcriptomics. Also, she's already published many scientific journals in related field. From today's lecture, she will deliver the topic entitled Molecular Approach for Canine Oral Cancer Management. Okay, ladies and gentlemen, please welcome Dr. Sirinun Pisamai, Doctor of Veterinary Medicine, Doctor of Philosophy. For Dr. Sirinun, you are freely to use maximum 50 minutes for delivering the presentation materials. The time is yours.
Okay, thank you very much for your recommendation, and I will share my slide. Okay. Okay, all right. Can you see my slide?
Yes, we can see your slide, Doctor.
Okay. 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 Good morning, everyone. Selamat pagi. I'm not sure this is good morning for Indonesian language. I would like to thank, first of all, I would like to thank Dr. Surya and Airlangga University to invite me to talk today. And my name is Sirinun Pisamai from Department of Surgery, Faculty of Veterinary Science, Chulalongkorn University, Bangkok, Thailand. And most of my talk today will include my PhD work and the experience as a surgeon of oral and maxillofacial surgery as well. So the topic that you see, the molecular approach for canine oral melanoma, and my talk I will include about the canine oral cancer and tumor as well. Okay, as your invitation and opening ceremony, current position is a lecturer at Department of Surgery since 2018, and I finished my Doctor of Veterinary Medicine from here, Chulalongkorn University, Bangkok, Thailand, and my PhD work at Chulalongkorn University, Bangkok, Thailand as well. And my research experience, as you mentioned, about the molecular gene expression and proteomics. I did my work at Biochemistry Unit, Department of Physiology, and National Center of Genetic Engineering and Biotechnology, Pathum Thani, Thailand, for proteomic work. And I have a short experience to do more about the gene expression like transcriptomics. at Faculty of Health and Life Science, University of Liverpool, United Kingdom in 2017. So this is my publications. Most of my publication is include my PhD work about the gene expression, about cell adhesion molecule, invasive gene expression profile, and proteomic with the tissue proteomic. And after that, when I finished my PhD, I start to do like a lecturer at a Department of Surgery. I have an opportunity to like a co-researcher of proteomic as well with the saliva proteomic and other field of canine oral tumor. Okay, I think all of you know about a little bit of my work. The outline of presentation today, first of all, I would like to talk about canine oral melanoma. This is an important disease. Why I would like to talk, why I would like to work with canine oral melanoma. I will talk about the important rationale and specific of the canine oral melanoma. And then I will talk about my work about gene expression of canine oral cancer, not only canine oral melanoma, but also canine oral cancer. And proteomic on canine oral cancer as well that I mentioned about tissue proteomics, and I have an experience have an opportunity to do a saliva proteomic as well. And then I will brief talk about how to apply my work to clinical application. Okay, first of all, this is the first picture of my patient. This is inspiration. This is a rationale to do the canine oral melanoma. Canine oral melanoma is one of the biggest problems of the oral health, especially in dogs. Most of patients come with late stage of disease at the diagnosis. And you can see this picture. This picture shows the big masses in oral cavity of dog. And the reason that oral cavity is the area that might not be taken care by owner as much as possible. And you can see the picture of cases with canine oral cancer, especially canine oral melanoma. And you can see the picture from the left-hand side. The mass are deposit on the mandible or lower jaw. And also, when the aggressive mass, you can see the mass deposit on the maxilla or upper jaw as well. And the biggest problem that the owner faces is that pets cannot eat and feel uncomfortable always. So the incidence of canine oral tumors in small animal teaching hospital, Chulalongkorn University, since 2018 that I collect when I start my PhD work. More than, you can see the blue area, more than 50% is melanoma. And the second most common oral cancer is oral squamous cell carcinoma, approximately 20%. And some are benign and other cancer. So you can see the picture of left-hand side. This is a picture of squamous cell carcinoma, the second most oral cancer. You can see look like a pink mass at the mandible and the histopathologic picture here. And the right-hand side, you can see the picture of canine oral melanoma, the black masses and histopathologic picture as well. You can see the melanin pigment deposit in the cancer cell. For the oral melanoma, you will see like a brown to black masses. It might be highly or slightly pigmented or less or non-pigmented as well. So for the non-pigmented, you can call a melanotic melanoma. And dogs are difficult to eat difficult to eat, red breath, due to the oral pain, oral bleeding from masses, and some of patients, mandibular fracture might be found if the masses invade to the mandible. So you can see the picture of skull radiograph. You can see the tumor that invade to the mandible, and then you can see like a sign of mandibular fracture as well. So this picture is the appearance of oral tumor, especially in the maxilla. You can see the asymmetry face, like a area of swelling under the ocular area here, and this one is the masses deposit in the mandible and the mandible as well. This is a very severe and very like a pain. This is a problem, biggest problem of oral cavity in dog that I mentioned. So in general, prognosis is based on the clinical staging of oral tumor in dogs from World Health Organization standard. There are 4 stages according to their size and metastatic behavior. You can see this table. Stage 1, less than 2 centimeter diameter tumor, and stage 2, 2 to 4 centimeter diameter tumor. Stage 3, more than 4 diameter tumor, and of lymph node metastasis. And the stage 4, distant metastasis will occur. So for the data of median survival time of oral tumor in dog, especially in canine oral melanoma, for stage 1, MST or median survival time is about 17 to 18 months after we meet the oral cancer in the patient. And stage 2, 5 to 6 months, stage 3, 3 months, and stage 4, 1 month, because of distant metastasis occur in the body. Right now, I think that we know that canine oral melanoma is the most common malignant tumor in oral cavity of dog, with an aggressive behavior, high metastatic potential, especially in regional lymph node, lungs, and other organs. Moreover, both of cases is poor prognosis. I think due to one of the factors, this worst outcome is late stage of disease at the diagnosis and poor treatment response. I mean that the standard treatment like surgery, chemotherapy, or radiation therapy that not meet successful outcome as much as possible because of late stage of disease at the diagnosis as well. And for the treatment of this disease, gold standard treatment is surgical remove with radical surgery. I mean that if you found like a mass at the lower jaw, the treatment that's the enough treatment is mandibulectomy or remove of lower jaw. And if you found a tumor at the upper jaw or maxilla area, the gold standard treatment is remove or maxilla or total maxillectomy. And other treatment that will come to cooperate, like to improve your successful rate of treatment, is radiation therapy. And for the canine oral melanoma, response of radiation therapy is moderate to good. And other treatment is chemotherapy, like a carboplatin or platinum-based chemotherapy drug, or specific drug, or paradia or tosilanib as well. Moreover, right now I think look like almost 10 years. Melanoma vaccine will come to treatment aspect of canine melanoma as well with the immunotherapy. Okay, I put this table from textbook which show in 2013 to wrap up all common oral tumor in dogs and cats. And this table, you can see the summary of all oral tumor. And you can see like a left panel about the distant metastatic cause appearance, bone involvement, surgery response, radiation response, and summarize of breast treatment, prognosis, and median survival time. And you can see malignant melanoma or canine oral melanoma is the most common oral cancer, and is usually found fair to good prognosis and low median survival time, and cause of death is distant metastasis. So at this moment, I think everyone here might know that what are the important topic, what are the important rationale of my work, because of we cannot find or diagnose the canine oral melanoma or other cancer that's an aggressive tumor at earliest time. This is a big problem that's stuck with the unsuccessful treatment as well. So when I start my PhD, I interest about the hallmark of cancer, how cancer development, how cancer progress. And so you can see the hallmark of cancer. This is a diagram that shows the various factors were described for the cancer progression. Many aspects here, and one of the aspect or one of the topic at I interest is activating invasion and metastasis, because of we focus that the big problem of canine oral melanoma is the very rapid invasive behavior, and the cause of death is distant metastasis. That's why we would like to point this factor activating invasion and metastasis. And if we look at the gene change in gene expression of cancer, one of the circuit is motility circuit, and you can see some genes here, protease, that cleave the extracellular matrix and cell adhesion molecule to provide the pathway for cancer metastasis. So this is a point that we interest, activating invasion and metastasis. So this is a diagram that I briefly estimate to understand about the cancer cell invasion and metastasis in brief. And you can see this picture. Cell adhesion molecule is E-cadherin, the pink one, and the red one, silicon one. So for the E-cadherin, that link between cancer cell and epithelial basement membrane. And for the silicon one or SDC one that I will mention much in the next slide, also link extracellular component to the epithelial basement membrane as well. The step to provide cancer cell invasion and metastasis start with MMP, also cleave the extracellular matrix molecule, cell adhesion molecule, and create the pathway of cancer cell to migrate to distant sites along the vessel here. And then cancer cell travel through the vessel and migrate and deposit to the distant site. So this is a briefly diagram to understand how cancer cell invasion and metastasis in my aspect. Okay, So if we would like to study how gene expression, how protein function, how cancer cell invasion and metastasis, or find any more of biomarker for canine oral cancer in the future. There are many tools to study the gene expression at mRNA level or protein level. In brief, so I think the central dogma that everyone know, but I brief describe here. DNA transcribe to RNA and RNA translate to protein to making to working in the cell. So if we would like to study gene expression at mRNA level, the tool of study is so many tool of study, but the gold standard or the frequently used in most of researchers at a molecular era is quantitative reverse transcription polymerase chain reaction or qRT-PCR. And if you would like to study all gene expression with non-bias of the intergene, transcriptome is coming to one of the effective tools to study as well. And if you would like to study the protein expression or gene expression at protein level, the specific protein that you would like to start to study, you can use like a tool of immunohistochemistry or IHC and Western blot. So here that use the benefit of antigen and antibody conjugation. And if you would like to study all of the protein in the cell in this any situation, proteome profile or proteomic analysis will coming to solve this problem. Okay, the fundamental technique that we use is qRT-PCR, and the principle is using a fluorescent probe to bind to PCR products, and the machine can detect the fluorescent signal as the real-time reaction. So this is a brief principle of qRT-PCR that I will talk. So from this technique, quantitative reverse transcription polymerase chain reaction, we use this technique to perform this work: gene expression profile of cell adhesion molecule, matrix metalloproteinases, and their tissue inhibitor in canine oral and canine oral tumors. So this work we published on research in Veterinary Science 2017. So we found we use for the bacterial and method, we extract the tissue sample from canine oral tumor in various groups, not only canine oral melanoma, but also canine oral squamous cell carcinoma, benign oral tumor, and normal control. And then we extract the RNA from tissue sample and convert the RNA product to complementary DNA, and then use the specific primer of our interest gene to study gene expression by qRT-PCR. And for the result, we found decreased expression of cell adhesion molecule. CTH1 is represent the gene of E-cadherin that I mentioned, and we also found decreased expression of silicon-1 and nectin-4 as well. So 3 molecule is the gene that involved with the cell junction, cell adhesion to make the cell stronger. And we believe that if this group of cell, this group of the gene decreased expression will provide a pathway for cancer migration and metastasis. And moreover, we found the high expression of matrix metalloproteinase to like a cleave ECM molecule to promote the cancer cell invasion and metastasis, promote the invasive behavior of canine oral cancer cell as well. Moreover, in early stage oral melanoma, we found a high expression of matrix metalloprotease in the other group, or matrix metalloprotease 14 and increased TIMP1 as well. In the summary, we found that loss of cell-cell adhesion during cancer cell metastasis, and for the TMP1 and MMP14 expression could probably serve as marker of early stage tumor as well. So this work we found like a potential tumor marker in oral tumor group in the part of gene expression of mRNA level. So this picture we confirm to diagnose canine oral melanoma by immunohistochemistry of Milan A protein positive. And then when we know that how gene expression profile like a group of invasive gene expression to answer the aggressiveness of canine oral cancer by tissue infection and metastasis. We would like to know more about other proteins that involve with canine oral melanoma because protein can reflect the cellular function. That's why we would like to start the proteomics. What is proteomics? Proteomics is the term of study. We come to study with the whole protein in the cell or proteome using high throughput technology or mass spectrometry. So you can see the picture of mass spectrometry. This is like a machine to weigh some of molecule. In here, I mentioned that is a protein in your sample. And then you will got the protein name or protein fingerprint in your sample. Not only some specific protein that you interest, but whole of the protein in the cell at any situation that you would like to study. And for the proteomic methods, the name of instruments come from the type of the part of mass spectrometry I will describe briefly about proteomic method. First of all, first step is the protein separation by gel electrophoresis or SCS page. Not only 1DE gel, but also 2DE gel as well. And then use all of protein in the gel or select some spot from 2DE gel to analyze the protein identification. Moreover, the step of protein separation not only based on gel base, but also HPLC that we also use. So, and then if we separate protein to reduce like a complexity of protein sample, protein identification will do for to find like a protein that you would like to study by the instrument that I mentioned in last slide is mass spectrometry or MS. For the mass spectrometry or step of protein identification include of two parts of components in mass spectrometry about the ionization and mass analysis. For the ionization part, it's usually use of Monitor and ESI. And for the analysis part, there are so many platforms to fit in the mass spectrometry. For example, ion trap, time of flight, and triple quadruple. This is the name of any platform. And then if you would like to study the amino acid sequence and blast with the protein database to find the name of protein, you can use like a MS 2 time. So MS 2 time that I mentioned is the first MS that we use ESI for ionization and then analysis mass. After that, select the high frequency of peptide mass to separate and activation again by argon gas, and then analyze the sequence of peptide and blast with the database that you would like to select if you do in the animal or dogs, you can browse to the dog database, or you would like to find a new protein that not just exhibit on dog database, you can browse with the mammalian database or human database as well. This is a brief platform. So one of the popular technique that I mentioned in the last slide, the name of platform or technique of proteomic or mass spectrometry, the name of instrument come from the components of ionization and mass analysis part. So this is one of example. Monitor MS is main ionization part, you use MAUDI, and analysis part you use TOF or time of flight. And this is one of popular technique, Monitor MS or metric, as this has laser desorption, ionization, time of flight, mass spectrometry. So the brief principle, the sample will mix with the metric component, and then laser source will hit to the protein metric, and then the ionized protein will run in the mass analyzer or TOF and detect the mass. The smallest mass are detected first at the ion detector. And for the result of Monitor MS, you will get the peptide mass fingerprint of each sample. This is for example of my result. You can see the peptide mass fingerprint of any group of sample, and I will talk later when I talk with my paper. So in our technique of proteomic that popular and I use in my PhD work is gel CMS or in gel digestion coupled with mass spectrometric analysis. This technique, protein sample is separate to 1DE gel or one-dimensional gel electrophoresis to reduce the complexity of protein sample, as I mentioned. And according to their molecular weight, and then cutting all the protein bands is performed. And next, the protein will be digested into peptide solution, and peptide solution will be analyzed by LC-MS, and the protein sequence from LC-MS will blast to the protein database to search the type of protein, and then analyze it like a bioinformatics analysis by program, for example, statistic evaluation, protein ontology, pathway analysis, and function associated network. All of these processes will drive to this work, proteomic analysis of canine oral tumor tissue using Monitor, mass spectrometry, and gel and in-gel digestion coupled with mass spectrometry or gel CMS approach. So this work I co with Dr. Sithirak Roytakul from Biotech, NASA Thailand, and their team, and Dr. Kannapon Suyapon as my principal advisor when I study PhD program. So this work, we perform proteomic analysis of canine oral tumor tissue, which are early and late, oral melanoma, oral squamous cell carcinoma, oral benign oral tumor, and normal control from normal gingiva tissue. So in brief, after we isolate protein from tissue sample that we collect after surgery, we pull the protein sample of each group before analysis to reduce like a variation of individual sample of each dog. And then we separate the sample in two ways. First way is the sample mixed with metric solution and spot on multiplate to do a Monitor MS, and then we got like a peptide mass fingerprint and 3D PCA plot to separate various groups of tumor separately. And other way, we separate the sample to do a SCS page to a protein separation before proteomic process, and then we cut or we cut all gel band and digest all protein from gel band by trypsin, or the step that we call in gel tryptic digestion. And then the peptide mixture that in that digest with trypsin will analyze by gel CMSMS, and then we got like a amino acid sequence of each sample and blast with the doc database, and we got the candidate protein. Okay, for the result from the first part is multi-top mass spectrometry. We got like a peptide mass fingerprint pattern of each group as shown in this slide or this diagram. And you can see that the different PMF pattern of each group here: normal, early stage oral melanoma, late stage oral melanoma, oral squamous cell carcinoma, and benign oral tumor. So this diagram, you can see some peptide peak that cannot see in normal group. For example, here or here, the peak E, you can you only see in cancer group, but you cannot see in normal. And okay, and some of peak you can see in all of group, but some group found higher expression as well. So this finding might be used for diagnostic screening test for oral tumor. If we collect more sample of each group, and if the new sample have a mimic PMF pattern that fit to any PMF pattern shown here, you can use this this platform for screening test that will make the improve the early diagnosis of canine oral cancer in the future, not only based on the histopathology only. And the second part of this work, we perform LCM-SMS. From GLCM-SMS, we got 1,572 protein from this technique. And you can see the Venn diagram show the unique protein of each group here and the co-expression protein between group as well. So the unique protein, I mean that this protein only found in normal group, that only one protein only found in benign oral tumor, and only one protein found on oral squamous cell carcinoma, and moreover co-expression protein that only found in cancer group. And all of about 1,572 protein can be can be classified according to the biological process and cellular component by Panther classification system that I mentioned about the step after we got the all of protein, this step of bioinformatics to analyze all protein that we gain from this technique. Moreover, we select the all candidate protein from Venn diagram that I mentioned about the unique protein of each group or some protein that's co-expressed in cancerous group only. All candidate protein have an associated role with cancer development that we use the core-stitch program to find association of protein, and we put the candidate protein and the red circle here with the component of chemotherapeutic drugs, cisplatin, doxorubicin, and you can see like a network link between our candidate protein that we gain. So this slide concludes that all of protein that we gain from this technique involved with cancer pathogenesis and cancer development as well. So it might be used this protein as a tissue biomarker for canine oral tumor or cancer in the future. So this work, proteomic analysis of canine oral tissue using MALDI-TOF MS, followed by LC-MS, MS, and GLC-MS approach were performed in the first time of canine oral tumor, and distinct PMF pattern among canine oral canine normal จริงใจว่า oral melanoma oral squamous cell carcinoma benign oral tumor were established using Mycotoxin MS that I mentioned we can use Mycotoxin MS like a screening tool for canine oral tumor diagnosis, and the separated PMF cluster of PMF of Mycotoxin MS should be used as a new diagnostic tool that I mentioned. And then recently, after I finished PhD, my colleague worked on the saliva sample, and I have an opportunity to like a co-researcher, and I will talk to you about the saliva sample for proteomic as well. Recently, Overturn established the proteomic from saliva, and the advantages of salivary samples are directly contact with the tumor or cancer cell, non-invasive, easy to perform, and cost-effective. So easy to collect and non-invasive, and we believe that this is the material that directly contact to the tumor. So this work, Dr. Sekarin Poipet and his colleague performed GLC MSMS on salivary samples. The saliva sample from various groups such as CP here represent the periodontitis and normal control, and benign oral tumor, early stage oral melanoma, late stage oral melanoma, oral squamous cell carcinoma. And then all of protein sample like the individual sample were separated in SCS page to reduce the complexity in the first step of proteomic for protein separation. Cutting all gel band trypsinase and then analyze the peptide by GLC MSMS, and they got the candidate protein and then strongly confirm the candidate protein by Western blot technique. Taken together or candidate protein or candidate protein that we found also linked with the cancer pathogenesis by bioinformatic tool like I did with the stage pathway from tissue proteomic. So this technique they got like 3,726 protein from whole saliva of all group, and then they got like a candidate protein PTPN5 and TP53 should be a potential salivary biomarker of canine oral tumor from saliva sample. And the results strongly confirm the candidate protein PTPN5 and P53 by Western blot technique. They not only perform the confirm by saliva sample, but they confirm from tissue, from cancerous tissue, and they found that these two proteins also found in cancerous tissue as well. So this is a platform how to develop like a biomarker of oral tumor from saliva sample. It is a necessary point to confirm the protein that we gain from this high throughput technique is the specific antibody to bind the antigen or protein sample in any type of sample, not only saliva but also in tissue sample, and they got the confirmation that the protein that they found in the proteomic technique also found in tissue sample as well. And then after that, the same team, Dr. Poipet and Dr. Raitakul and team and Dr. Suryaphon performed the next chapter of salivary proteomics. This work, they used the individual salivary samples of patients with various types of canine oral tumor and control to do the Mycotoxin MS. So this work this work, they did the saliva sample and then pull the sample of each group and spot on multipage, use the Mycotoxin MS and use the peptide mass fingerprint to select the specific protein, and they did the candidate protein to confirm by LCMS and Western blot again. So this work is different from the previous work because they use the individual sample and they found that they got like a PMF pattern of each group and the specific protein or candidate protein as well. This protein is SNP7 that involved with the cancer pathogenesis. And then they confirm from saliva sample with the Western blot technique, and they found like a SNP7, TLR4, and NF-kappa B in canine oral cancer with the salivary sample. So finally, from 2 papers, they found new potential salivary biomarker for canine oral cancer from proteomic approach to use the saliva sample. So far, to summarize the main point of my talk, this clinical application, proteomic technique includes Mycotoxin MS, Mycotoxin coupled with LC-MS-MS, GEL-C-MS-MS, and LC-MS-MS might be used to screening oral tumor in dogs and to find the biomarker for and to find the biomarker for oral and to learn the cancer pathogenesis as well. Moreover, the gene expression at mRNA level can answer the cancer cell pathogenesis by qRT-PCR too. Okay, right now, I think that my talk will inspire everyone to exhibit the research to the clinical field, not only the technique that I mentioned, but also new molecular technique. This is a research trend. This slide shows the research trend that I saw since 2019 to present, such as transcriptome and genome analysis. And the aspect that's very interesting is the association of human melanoma and canine melanoma to develop the knowledge of canine oral melanoma as the human model. So this is a research trend to recently 2 years later. So finally, I would like to thank Associate Professor Dr. Kanapon Sriyapon from Biochemistry Unit Department of Physiology and Dr. Sithirak Roytakul from Genome Institute Biotech NASA Thailand, Associate Professor Chanin Kanprawit from Department of Surgery Chulalongkorn University, and Associate Professor Dr. Anuthep Rangsi Pipat from Department of Pathology, and Dr. Panravi Phumuthisan from Department of Surgery, and Dr. Sekarin Poipet from Department of Clinical Science and Public Health, Mahidol University, Bangkok, Thailand. Okay, that's finished all of my talk about the molecular approach to clinical application of canine oral tumor. Thank you for your attention.
Okay, thank you very much, Dr. Sirinan, for your remarkable lecture and also inspiring sharing of knowledge, I think, and also it's very, very comprehensive materials. And now we already finished the first speaker presentation, and we will move to our second speakers, to Dr. Sirinan. We will perform discussion in Q&A session in the last or after the presentation of the second speaker. Thank you. Okay, so before we get started and continue to our next speaker, again, kindly reminds you can still submit your question through Q&A panel below your screen, not in chat panel because we will not notice your question. And also, in addition, don't forget to indicate or address your question which aim to the speaker. Is it for Dr. Sirinan or our next speaker, Professor Dr. Muhammad Lazuardi? Okay, so let's continue to our second lecture. Our presenter who will deliver the lecture is Professor Dr. Muhammad Lazuardi, Doctor of Veterinary Medicine, Master of Pharmacy. Okay, as you can see, his curriculum vitae on your screen is come from Department of Basic Veterinary Medicine, Faculty of Veterinary Medicine, Universitas Airlangga, Surabaya, Indonesia. And Professor Lazuardi research interests are in pharmaceutical science, pharmaceutical prescription, and pharmacognosy regarding various medical and veterinary therapeutic also. And Professor Lazuardi actively produced many international scientific paper and also proceedings. Interestingly, Professor Lazuardi still have time to publish many book chapters for academic and practitioner purposes. Also, Professor Lazuardi already produced scientific patent, which well known in Indonesia, namely Lazuardi Triangle. Okay, in the presentation, Professor Lazuardi will deliver the interesting topic entitled Drug Discovery for Veterinary Practice. So, ladies and gentlemen, please welcome Professor Dr. Muhammad Lazuardi, Doctor of Veterinary Medicine, Master of Pharmacy. For Professor Lazuardi, you are also free to use maximum 50 minutes for delivering presentation materials. To Professor Lazuardi, the time is yours.
Thank you very much. All participation, I will share my slide before. Already seen, everybody?
Okay, we can see your screen, Professor.
Yeah, drug discovery for veterinary practice. The audio is okay?
Yes,
audio.
We can hear you clearly, Professor.
Okay. Before I explain about drug discovery, I will explain about me. In 1984, I worked in veterinary drug assay and laboratory in DG Livestock Services Agriculture Department. And 1984, I researched in veterinary pharmacy science as a lecturer, and finished in Master of Pharmacy in 2001, finished in Doctor in 2004. And then research area is drug discovery, cancer, antivirus, health medicine for treatment hypoprogesteronemia. Start in 21, all participants, it can be learning in Master of Veterinary Pharmacy in postgraduate program in Universitas Airlangga. The new program for all participants about veterinary pharmacist master and veterinary pharmacist hospital and veterinary pharmacist master. Our outline. Principle, I have 1, 2, 3, 4, 5, 6 point. Principle using the medicine for veterinary practices, and principle of drug discovery, strategic for the obtain a new active substance, the overview of the obtain new perform of the medicine, the overview of the packaging system for the new medicine and regulation. Maybe start in one. Action of the treatment using medicine. Before explain about all of outline, maybe it's better here. We have four. Sorry. We have 4 points for using medicine. Namely, is CITO in a veterinary pharmacy, veterinary practices, and CITO in the namely from Latin language. In English is quickly. This must be quickly to be treatment of the diseases and the medicine, and must be quickly clearance from the body after successful using. It's very important. And then TUTO, or safety, safe for target treatment from disease, causes medicine, safe for environmental, and safe for human health after consumption of animal product. There's a problem in here because many residue in veterinary medicine and make AMR, yeah, antibiotic, antimicrobial resistant, and curare, efficacy. In English is efficacy, the right of indication to the right of the medicine at the right dose for the right dispensing form at the right times and route administration of the right patient. This is a very important tool for efficacy of the drug. And you can pleasure with animal welfare aspect, free from hunger, free from pain, free from injury, and free from behavior distress and other things. This is very important because all of product in medicine or drug must be thinking about animal welfare aspect. Different with human not no human welfare, but veterinary very strictly in animal welfare aspect. Medicine for veterinary practice. This must be changed our all of using veterinary drug. In veterinary drug, we cannot using by principle rational. It's very dangerous, but must be changed with motto, logic, and responsibility. Why logic and responsibility? Logic is from logos, from Latin language, as a science in English. Have a minimal 3 requirements. The first is must be done by method, by evidence base, and according to the period until a new concept of the medicine was found. This the number 3 is a concept thesis versus antithesis. And then responsibility. Why responsibility? Responsibilities because very easy to application of the drug in animal, not a veterinarian, but another profession, very easy. Must be by prescription with sign for obtain the medicine, monitoring side effect during the treatment, and then check the compliance using the medicine by client, check the implication for animal, environment, and health after consumption animal product. This problem in today because all of in the world thinking about one health. Nah. Okay, this principle of the drug discovery like this. I separated in 3 groups: group topical and group compressed tablet, compressed product compress, and group sterile product. Group topical like unguentum, cream, pasta, jelly, etc. And then group oral compressed compressed product, oral tablet, caplet, drachet, etc. And then group sterile product, ampoule, vial, flacon, and etc. Now, you can look in here. Can look. I will show you in. Now it's very clean, I think. Yeah, they have topical group here. Topical group have a feculum or excipient in yellow here. And then for excipient performing, this I have like white this. And then for active substance in gray, this gray. Now, in active substance, we can make a good performing by excipient performing. Something like this. Can be penetration more deep in ointment or cream product, but feculum like in yellow is commonly in a topical product. And then for group oral by technology compress is a tablet compresse, oral tablet, like here, caplet, drachet, and then many other things. Yeah, by active substance here and excipient in here. Excipient, the file will give better drug perform result. And then packaging here for protective excipient and active substance. This problem because the drug must be efficacy, safety, and efficacy. And another group, sterile medicine. Sterile medicine is in packaging ampoule, vial, or flacon. Here, excipient in white, and then excipient performer in another color, and active substance in yellow here. Now, for example, excipient performing, make added with liposome, some unilamer of vesicle. This make a long-acting product. Yeah, this technique for drug discovery. Another slide. Overview of principle drug discovery. Active substance. We can work about synthetic, semi-synthetic, and from herb and mineral or from origin of animal. New finding for new indication, for example, Nagano for anaplasmosis. This new finding for new indication, but the drug it's not it more than 20 years, I think so. Now, and then for excipient and packaging package, yeah. For example, by adding adepslane to increase penetration on topical product, oil formula on injection product to increase penetration on lipid body area, packaging by vacuum for maintenance the active substance of compound. This technique for principle of drug discovery. We have 3 points: active substance, excipient, and package. Now, strategy for obtain the new active substance. We have 2 methods, by design or by empirical study. By design, we have 3 methods: structure-based design or general approach, and ligand-based drug design, and computer-aided drug design, current optional. In today, combination ligand-based design and compute-aided drug design is very famous in here and now, yeah, because very expensive to obtain the new substance, active substance. By empirical study here. Now, empirical study, everybody in practices for veterinary practices can be used. Experience of practices using medicine to treat the disease but no specific indication. And for example, canine hypercholesterol by vertigo symptom using acetosa acidum acetylsalicylicum here, and it's okay for hypercholesterol. This is empirical study. For example, extract of leaf Mr. 2. Mr. 2 is parasite in a plant. Then drop to tanda elmic to treat hypoprogesteronemia. It's my project here. With empirical study too, and then can be combined with design, with structure-based design, legend-based drug design, computer-aided drug design here. Now, I will overview very hard for obtaining the new active substance. Everybody here in my map here must be thinking very hard, but very expensive and very long term for obtain the new active substance. For example, I will give you a description. Structure-based design here for first start, and legend-based design here. And then choose the drug target here. After choose the target, we can work in a big data with virtual tests, compute-aided drug design. We can counting with F-record, concept F-record, maybe everybody know here. And then efficacy, safety in human, animal environment, cost production here. It's a big data in here. Now, the science more than open and make a new theory with artificial intelligence here. Artificial intelligence for compute-aided drug design here. Now, from choose the drug target, obtain the pure preparation of target in solution. This after choose the target, and then from here can be applied in virtual test in CADD here, CADD, and then thinking about yes or not here. If yes is yes, must be analyzed with risk analysis and risk assessment. Analysis structure to determine possible inhibitor binding site target here. From CADD and here about 2 years, 2-3 years here. And then for obtain pure preparation of the target in solution can be explored again. Determinant of active substance by elucidation structure. Elucidation structure is very hard again, about 3 years. Elucidation structure contained with validation method. Validation method for one equipment about 1 or 2 years here. And then elucidation structure, very hard. From here, we have a new active compound here. But after risk analysis and risk assessment, we can make a homology modeling. Use a Knoven similar structure of modified sequence for desired target here. And then a new active compound must be tested again with, namely is pharmaceutic test about stability test, physical chemistry characterize, impurity, concentration, active substance, half-life, shelf life, etc. This about 4 or 3 or 4 years, very long. This a very expensive here. Similar with elucidation structure here, similar. And therefore here, the new compound must be tested in vitro test. It's very easy, about 6 months or 1 month, or 6 months or 1 year. This by cell line or something like this with in vitro with cell cancer in tissue culture, something like this. Now, after that, in animal lab test, we must have a two product test animal that a psychological close the target animal. For example, if we in human for drug for human must be test in a monkey, something like this, yeah. And for horse in intestine monogastric must be test in animal laboratory in monogastric, something like this. In very not longer, about 2 years or 1 year here, and that clinical trial. This not clinical area, but preclinical safety and efficacy here. 1, 2, 3 here, and then start in clinical safety efficacy. We start in clinical trial phase 1. Clinical trial phase 1 is a small population with condition control variable control, and then start in clinical trial 2. Clinical trial 2 is more big than population clinical trial phase 1. This similar to, but in region area, in region area, and after finish in clinical trial phase 2 and clinical trial phase 3. In clinical trial phase 3 is for the last clinical trial with a big population and another region, Thailand, Indonesian, or Philippines, Malaysian, something like this, or US, yeah, something like this. Clinical trial phase 3, about it's very short time, about 1 year or 2 years, yeah. And then another after that, launching the market, still trial with namely is clinical phase 4. Clinical phase 4 namely is post-marketing surveillance. Post-marketing surveillance in the market. This about 20 years. Maybe I will give explain about you know about Acidum acetylsalicylicum, found in Bayer in Second World War about 1938, 14, and then until 1985 or 1987, banned in all of countries because have a special bad implication, namely is agranulocytosis. Agranulocytosis is in the erythrocyte. It's problem in bleeding. Nah, and then Acidum acetylsalicylum, a very category is classification special for drug, must be by prescription, must be control. This you can look the map, not easy for obtain the new substance here. I don't understand why the very easy to obtain the substance of antivirus of COVID-19. Yeah, I don't understand why. And then maybe next slide I will explain to you. Now, based on the another concept is based on biologic response relationship. This is my project here. Progesterone, yeah, and then this active as an androgenic agent, biologic response 100%, and then I will separate it from parasite, the plant of parasite, namely is Mr. 2, yeah. In Indonesian Pendalu Duku, in Thailand similar, in Thailand, in Malaysia similar, in Asia, Southeast Asia similar. Yeah? We have a compound, active compound in here. If changed by substitution by ethyl and H2 and NO2 and SO2, we have a progesterone-like effect, about a 75% response and androgenic effect. Already patent maybe can production in manufacture. Yeah. Now, another thinking about beta agonist group. Beta agonist group, you know, inactive to body receptor in deep tissue here. And then ractopamine is a beta adrenergic agonist here, but and clenbuterol beta 2 adrenergic here, with penyl aminoethanol here compound. In similar ring, they have a similar action in pharmacodynamic here. It's a concept by quantification structure activity relationship method. Now, this androgenic effect in ring ABCD of progesterone here, ABCD here, and if changed by here in here, megestrol astat, androgenic effect more not high than progesterone, yeah, lowest than progesterone here, medroxyprogesterone astat here change, and then 3 here, more than lowest than medroxyprogesterone number 3, and number 4 here dihydrogesterone here, very smaller effect, adrenergic effect and pharmacodynamic effect in ring. The closed ring ABCD is similar here. Now, this concept based on a quantification structure activity relationship. You can look here by product sulfonamide, yeah, here. If changed by here by and nitrogen here, 2 nitrogen here, the dissociation of acid, constanta dissociation of acid 6.4, and then if change in methyl here, addiction with methyl ion here, constanta dissociation of acid 6.8, and then is methyl and ethyl here, dissociation is 6.7, and propyl here, dissociation 6.6, and OCH3 here 6.9 here, and very good in minimum inhibition concentration for Escherichia coli here. These are based on PSAR, quantification structure activity relationship, and ratio octanol buffer here 1.31, 1.49, 6.88, 16.8, 1.99 here. We change here, methyl, ethyl, propyl here, different here, and OCH3 high minimum inhibition concentration here. You know, O is a more negative orbital. It's a good for kill the microba, but C is positive. It very difficult for kill the microba here. Then, now, the name is ligand-based drug design or de novo design. You can look here in my project in 2001. After I'm finished in master degree. This penantidium group is antitrypanosoma. Ring of ABC similar in homidium bromide here. Homidium bromide here with bromide minus ion bromide mine, and homadium chloride, similar in ABC rings, but different in ion Cl here. Now, penetrium ring penetrate to lipid bilayer of the cell body. Why cannot penetration in lipid bilayer of cell body? Because they have a anthracene ring here, A, B, C, D, namely anthracene, and can be cycling energy here, and very hard for cut the binding here in anthracene here. And then for homadium chloride can be complex with mitochondria here, similar with pyrithium bromide here, can be complex with in mitochondria and stop the parasite as a trypanosome. Now, ligand-based drug design, for example here, antihypertensive. Antihypertensive, the cause of hypertension offer product of a peptide and angiotensin 2. Angiotensin 2 arise by loss of the peptide of unit from a peptide precursor angiotensin 1 by the action of enzyme angiotensin converting enzyme ACE. The structure AC analog with carboxypeptidase. It is carboxypeptidase here, internal wall blood here, internal wall blood, and 2-D-methylsuccinylproline can be inhibited in here, and like here, phenylcetiol here can be binding in here and stop the hypertension. This model ligand-based drug design, very popular and very famous in about life-saving drug for diabetic, cancer, something like this. Yeah, life-saving drug is about giving therapeutic long-term diabetic, and then for about stimulate in grow up, yeah, in bone grow up, yeah. Nah, CADD, computer-aided drug design, in silico chemical biology approach, is simulated the molecule of bioactive by software. In the market now, in the market, many market sold the CADD drug design. Yeah. Everybody can be buy, or every university can buy here, but very expensive. Added and substitution with other compound to make a good performing as therapeutic effect and stability of the substance, and then can predict pharmacodynamic effect of stimulated molecules for future production here. Many produce of new molecule at a time. Very simple and cheaper than PCR method or ligand-based drug design. It's very cheaper. Overview of CADD, like here. The first identified this disease, and then simulated protein structure simulated of the cause of the diseases, and then structure protein simulated in silico method here, and then simulated molecule structure in a program, a big data analysis, and then simulate production and analysis a benefit cost ratio, hazard dose risk, pharmacodynamic overview, and something like this. Yeah. This overview of CADD. CADD is a famous too in start in 1985 after concept of F-Recker. F-Recker is he's a professor in medicinal chemistry from Dutch, and died in about 1917. He's very famous about medicinal chemistry. Nah, this my thesis in 2001. 2001, yeah. We know suramin or nagano. Suramin is now is every country stopped here because the clearance and excretion not by metabolic but full of the drug and make impurity in environment. This problem in the world and stop here. But as a anti-trypanosoma working in kinetoplast target and binding to macromolecules very strong. It's very drug of choice for trypanosomes here. And then some molecule cut here, and this a product for anti-HIV AIDS. Binding to macromolecule very weak. And in trypanosoma full, binding of macromolecule very strong. And bioavailability until 4 months, very long. And excretion not by metabolite and full suramin. This in a molecule binding very weak. This some researcher thinking about anti-proliferation cell and myeloma cell, a potential to produce a cancer substance, but after simulated by CADD, yeah, this. Nah, diminasan asturat is a my project in 2004 in a PhD program. I will design here for more effective for trypanosome because suramin is top product for trypanosome. And then if you look here, it's a chelating interchelating agent in anti-DNA trypanosoma in the kinetoplast DNA. Like here, too similar kinetoplast DNA trypanosoma. This interchelating agent of anti-DNA trypanosoma similar in aganor here. This, but increased lipophilic so that the drug is available penetrate in the lipid in the of the lipid bilayer of trypanosoma for giving good trypanoside. The manipulatory augmentation dose already done here in ring of ring of Panyl here, here and ring of Panyl here. Nah, this interchelating agent anti-DNA trypanosome similar with Nagano here. But if the dose if not enough in the blood concentration, the resistance is available in trypanosome. It's problem to in here. You know, in cases in trypanosome, plasmabumin extravasation. Plasmabumin is a macromolecule, name is macromolecule for binding a drug distribute in all of body. And after distribute, the drug is relapse or binding and active as a trypanoside. Nah, this about concept the target of diminasan aceturat in this metabolism in cytoplasma in trypanosome. Target diminasan after flies, yeah, in here and saliva and skin, and then the trypanosome is make a big in a mature, and the target diminasan like here, variation surface glycoprotein here, or structure ANT glycoprotein here, diminasan here. Nah, this model drug discovery about biologic design. Nah, now we start in empirical method to obtain the new drug. The principle, we have a 7-point experience reductor of practices, report from other animal owners, report between practicing veterinarian, information from pharmacists, information from non-pharmacists, news from electronic media, etc., and then information from other news sources. This the 7th point might be everybody in all participants. Someday you can find 1 or 2 cases can be make an empirical method here. Now, characterized empirical method must be tested as an in vitro test. There are not many cases. The finding don't necessarily result in the same therapeutic response when tried on different clinical subjects. The occurrence is a specific in a certain area or region, and the new finding obtained cannot be applied massively before laboratory and clinical trials are carried out. This 5 points in here, characteristics of empirical method, but the advantage of the empirical method, they have beneficially. First analysis to following research laboratory, and research costs become more efficient. The new will be fast distributed and other researchers can be following in their lab. Good urgent cases such as COVID-19 pandemic case here, and can be done in developing countries that don't have a many sophisticated laboratory. This advantage of the empirical method here. Research costs become more efficient, can be cut the cost of research, and time of research can do it here. Weakness of the empirical method in emergent cases, the desire to apply a new drug from empiric cases is so fast and ignores safety factor. For example, using chloroquine. Using chloroquine for 3 cases patient on SARS-CoV-2 in infection. We tried the method here for cut in, like you understand in the map, last slide, my slide. It can be cut here. Stage of observation to obtain the new active substance is irregular and make high risk to the safety product here, because cut some state make a safety product not good performance. The uncertainty factor too much and make the product of medicine not perfect yet. There's a problem here. And make the product of medicine not perfect yet. You know about drug in pandemic 19. For example, chloroquine, and then another derivative. Yeah? Make uncertainty factor too much and make the product not yet perfect, not perfect yet. Yeah, here. Combination, another method is combination empiric method with KISAR method or ligand-based and CADD. Combination method to decreasing uncertainty factor. Based on time efficient, the combination will be production a good product more than level of GMP. We know that the timeline from design a new active substance until it is distributed in the market as new medicine and starting as a level 4 in clinical trial will take about a minimum 5 or 2 years and very expensive. By combination empiric method, KISAR, ligand-based, and CADD can be cut here, might be 6 years or 7 years, can be product a new substance active. Nah, this my program in Airlangga University, veterinary pharmacist. I will explain you it's a very long time of the active substance. Information 1985 about Mr. Parasite plant in Dendroctopatra in Southeast Asia, similar, yeah. Namely, yeah. similar. And then from information from a woman 80 years old about cancer and breast cancer, after drinking about infus of here, very not very good, yeah, very good health. And then I will try here infus or decocta process. And last of 1985, we thinking about obtain a new active with team trial to in vitro in myeloma cell line in 1986, 1987, and then we obtained the trial to in vivo in rat and mice myeloma cell 2 in 1988, 1919 here, and percolation of life in semipolar, polar, and non-polar here, and isolation identification in 2004 and until 2020. And the ongoing activity obtain anti-cancer here. But I have obtained androgenic effect in 2006, 2016, and patent here. Progesterone-like effect, namely is progesterone-like effect. Now, from here, with the team in Taichung University in Taiwan, make a virus avian influenza, and maybe for virus COVID-19, yeah, but stop ongoing, but because stop lockdown in 2019, I'm stopped here. And then we start in number 2, progesterone-like effect here. And I make a performing to androgenic effect by slow release injection here, by slow release injection here. And after here, all of participants can be thinking about start in 1985 and finish in 2019 to 2016, a very long time here. Not easy for obtain the active substance. Now, new performing the medicine. Now, this is non-parenteral and parenteral. Non-parenteral is a topical dosage form, semi-solid for and like something like this. Good penetrated, physical property, appearance, clear, translucent or opaque, viscose, feel, greasy versus non-greasy, cooling, sensation, stiff, soft, no peak, microscopic 400 magnifier, oral liquid and solid dosage form, delivery system control. This non-parenteral can be new performance of the medicine. Parenteral by excipient, delivery system control, and then sustained release control, time release, slow release. This make a long-acting performance. It's my program here, 2000 and until next year with the team in Taiwan, Taichung University, Asia University. Sorry, Asia University, in Taichung. Now, this example slow release parenteral here, injection by magnifier 1,500. One part of liposome, one part of diminution here. But 5 part of liposome, 1 part of diminution here. Now, this FTIR, the good aspect in A with component 454 liposome in 50 milligram mg of diminution, but in B is very slow, 234 mg of liposome with diminution of 50 mg. This is standard. Now, why in here the area is a big here? Because they have space for absorb of water here. This is specific in water here. Now, it is like here, very not very similar in area in standard here, and make a biology active is very good. Now, this I will try here. This diminution in 50 mg and 454 mg liposome in A. We have mean resident times in minutes. Yeah, mean resident time here. The equation is AUMC per AUC. Yeah, or dose with ratio dose and AUC under curve. Yeah, here. Now, in 234 mg and liposome, and not satisfaction, but 5 times of mean resident time. By this added with liposome here, make diminution, make a long-term action here.
Sorry for interrupting, Professor. Your presentation have 5 minutes left.
Yeah, thank you.
Yeah.
The objective manipulate performance of medicine, manipulate vehicle excipient as slow release, vehicle a long time perform, make a deep tissue, and a topical application systemic effect, for example, anesthesia or ointment. Maybe I will try for quickly. Yeah? Manipulate vehicle and clinical veterinary clinical services. For example, Acidum acetylsalicylicum, very hard for dissolve in water, with added by calcium carbonate in equal part, very easy. Chloramphenicol, smell bad, but can be manipulated by entry in the capsule. This penicillin oil, something like this, very easy for distribution in muscle after injection. This overview of the packaging as principle of packaging I will product here. There's a structure for aminoglycolin for anti-malaria here, can be stopped in metabolite here. But chloroquine, quinine, and hydroxyquinine for SARS-CoV-2 might be yes or not. Nah, this rational. Yeah? This myeloma cell cancer with stopped mistal 2 of dendrop tube tanda elmic. Okay, maybe by virus SARS-CoV-2 it's very successful, but maybe dream come true. Nah, life is like a riding bicycle, but keep moving. Thank you. Is everybody if want to contact me, can be email address me. Okay, thank you.
Thank you very much, Professor Lazuardi, for your comprehensive lecture and also inspiring sharing experience, I think. Okay, now we will move to discussion or Q&A session. As I can see in screen, there are many questions for both of our remarkable speaker, Dr. Sirinan, and also Professor Lazuardi. And several questions already answered by typing in Q&A box, but I will read it again one by one, but we are very sorry if we can accommodate all of your question due to webinar time limitation. Okay, for the first question, I will read. First question for Dr. Sirinan Pisamai. Okay, my name is Palagan Senopati Suwoyo, and currently I study veterinary medicine in Udayana University, Bali, from Udayana University. And currently I do research my undergraduate thesis about fibrosarcoma treatment, and I want to ask a question. What is the best treatment approach for oral soft tissue sarcoma, such as fibrosarcoma or fibroblastic sarcoma. According to Bray 2016, there's high chance soft tissue sarcoma, approximately 40% to metastasis after successful surgery. And most of them are having poor prognosis with low life expectancy. And if I am not mistaken, the chemotherapy drug like doxorubicin has a risk such as cardiotoxicity and have side effect heart disease in animal. And also, is it sufficient to use histopathology without immunochemistry staining as diagnostic approach in order to identify the cancer type and the malignancy? Because the staining, I think, is still expensive in here. Okay. To Dr. Sirinan, you allowed to answer directly to the question.
Okay, for these questions, I already typed in the chat box. So for the soft tissue sarcoma, the prognosis is better than other cancer that I mentioned, oral melanoma and squamous cell carcinoma. So the best treatment that I answer is surgical removing with at least 3 centimeters away from the mass, because this cancer is locally invasive. It's a big problem. But the chemotherapeutic drugs, right now, we didn't use the doxorubicin that you mentioned about the toxicity of this drug. So the drug that will come to treat the oral cancer in any type of oral cancer is like a targeted therapy, tozoramide, or a platinum-based chemotherapeutic drug about carboplatin and cisplatin that also have a side effect or toxicity to renal or the other organ as well. But normally, before we using the chemotherapeutic drug, we will monitor or test about blood test or general testing of patient before using as well. So this is my answer.
Okay, I think that's the points and of answer from Dr. Sirinan. And we're going to second question. Actually, this comes from our senior researcher and also Vice Dean of Faculty of Veterinary Medicine, Dr. Iwan Sarial Hamid. This is also for Dr. Sirinan. How about the effectiveness of the concept in angiogenesis inhibition in cancer compared to chemotherapy and surgery? For your information, angiogenesis inhibition clearly prevent the development of tumor cell because the lack of oxygen and nutrients also prevent blood flow carrying carcinogen compound. Oh, okay. For Dr. Sedinan, you may allow to answer directly to the question.
Okay, I disconnect. I have problem of network. Oh, please read the question again because the chat box panel is empty.
Okay. Yes. Yes. Actually, this is directly for Dr. Iwan Sarial Hamid. Question for Dr. Sirinan. How about the effectiveness of the angiogenesis concept inhibition in cancer compared to chemotherapy and surgery? For your information, angiogenesis inhibition clearly prevent the development of tumor cells because the lack of oxygen and nutrient. Also, it is prevent blood flow carrying carcinogen compound. So I think where is the better approach compare chemotherapy and surgery?
Okay, right now for immunotherapy, like the onset that you mentioned for canine oral melanoma is coming, but the onset vaccine, so for the successful rate, I think it depends on the staging of disease at diagnosis. If we can treat the canine oral melanoma at the early stage, I think if we use the onset vaccine with the stage 1 canine oral melanoma, successful rate is more than 50% because I cannot calculate the successful rates at the percentage, but I have the information about median survival time. For the stage 1 canine oral melanoma after surgical resection, and we using of the onset immunotherapeutic vaccine, we can prolong the lifespan of oral melanoma patient to 1 to 2 years or more than 2 years. And then they may be dead with other disease because of most of patients with canine oral cancer come with the old ages, more than 10 years. And to compare with the chemotherapy, I think the similar, I would say that the objective to use the chemotherapeutic drug is to prolong the survival time as well. But the chemotherapeutic drug can use in any stages. Moreover, chemotherapeutic drug has an toxicity and side effect as well. If we can select the vaccine, I think it's better. But limitation of using vaccine is we can use only in the early stage of oral melanoma. Okay.
Okay. I think that's a comprehensive answer for Dr. Sirinan, and hopefully Dr. Iwan also got all of the points today. And I will move into next question. Actually, now for our second speaker, Professor Laswardi, from Dr. Purnaning Dian Isnaini. Assalamualaikum and good morning, Professor. I am Purnaning from Faculty of Animal Science, Universitas Halu Oleo, Kendari.
Good. Yes, okay.
I have two questions for Professor Laswardi. For the first one, is it necessary to use encapsulation method for active compound in drug for ruminant? Because ruminant have more complex digestion than monogastric animals. If it's yes, what is the best choice of encapsulation use method? And the second question, also from Dr. Purnaning, if the active compound of the drug is not isolated, for example, the use of crude extract of herbs as drug, how can we protect the active compound from the rumen digestion? Thank you. Professor Laswardi, you allowed to answer directly.
Okay, thank you. I will try to answer Mrs. Purnaning Dayan Isnani. Your question very good question, very attractive. You know, in a capsulation in method for oral, the capsule in gelatin operculate is maybe dissolved in HCl GI tract about 15 minutes. Is problem here. You can make with suppositoria, changed by suppositoria, or you can make in injection. Suppositoria is very difficult because in cattle or animal husbandry, the rectum not much in absorption, but you can change in injection. Like my research in Mr. 2 and parasit Benaluduku, yeah. This I can make an oral because very hard in HCl GI tract, and then I change to injection, something like this. Injection must be you have 5 points. The first is sterile, pyrogen free, isotonis, isoionis, isohydris. 5 points here. You know, in injection intramuscular, not more specific with in the blood vessel. The molecular size not specific, not you can make a big molecular size, it doesn't matter, but must be 5 point here. Free from pyrogen, sterile, and isotonis, isoionis, isohydris, something like this. And the second question is the active compound isolate, for example, use it. How can we protect? You cannot protect anything because of very you know HCl in the GI tract for until pH 4 can be solve the all of about in plant. It's better you change in injection and you make menjadi salt in salt and about pH about 6.8 pH or 7.1 pH enough. I think so, something like this. And then another question.
Okay. Yes, I think it is already answered, and we will proceed to the next question from Dr. Isa Mahendra. It is also for Professor Lazuardi. I am Isa Mahendra from National Nuclear Energy Agency of Indonesia, or BATAN. In our institution, we also do the drug discovery research using the radioisotope utilization. In the determination of pharmacokinetics and biodistribution of the drugs, we have to extract the active compound in the organ. Usually, we utilize the radioisotope to determine it. Is there another method to extract the active compound in the organ? Or yeah, this is also a message. I hope we can do a collaboration research in the future.
Yeah.
Okay, you may allow to answer, Professor.
Yeah, thank you. I will try to answer. Mr. Isa Mahendra, nice your question and nice your activity. Must be usually make a good activity like here. I will explain to you about preparation in organ. Preparation in organ is not easy for you because of many impurity in organ, but you can separate it with a special column of HPLC, separated in HPLC. You can like here, but after isolated in with SPE, something like that, and you can preparation in HPLC with column separated, separation HPLC, and then you have pure obtain on in active substance in organ, and then you can by biomarker in isolated here for radioisotope. It doesn't matter in the column of HPLC. You can preparation here, but special HPLC in special column with low pressure HPLC, not high pressure, low pressure, or you can change in change about in big SPA solid phase extraction, and after isolation you put in HPLC in low pressure column, I think like this. And it's okay if you want to collaboration with my lab, it doesn't matter. I hope your friend, all of Batan office or researcher in Batan can collaboration with me. Okay, it doesn't matter. We have a Center of Veterinary Pharmacies in Surabaya, and we in February 2021, maybe Magister of Veterinary Pharmacies will be launching. Maybe you can collaboration with researcher in Erlangga University. It doesn't matter. Okay.
Okay, thank you very much, Professor Lazuardi. I think that's all for the Q&A session. This is because due to webinar time limitation, we will move into.
There's one question, Eka, in this Dr. Eka, yeah. How?
Okay. Yes, you may answer the question, Professor.
2 minutes enough. How do you know the impurity, some compound in certain material, rhizoma, something like it's very easy. You can look in the FTIR. FTIR, you can like me, and then the special in area wavelength, you can look in impurity here. Very easy, very easy. Thank you. Yeah.
Okay, thank you very much for your comprehensive answer. And now we will end this Q&A session. But first, let me try to conclude the important points or scientific message from both of our remarkable speakers. For the first one, the material from Dr. Sirinan, molecular approach is very important to strengthening diagnostic method regarding canine oral cancer. Moreover, by using molecular approach such as proteomic method, we can have the detail of information related to the cancer development. Also, the veterinarians can perform early diagnostic in oral cancer so that the therapeutic effect could be applied accurately. And also from the second material, Professor Lazuardi, a new drug discovery in veterinary subject or human medicine needs a long time research and clinical trials, but we can also using in silico study design method to increase the effectiveness of drug therapeutical potency. Okay, I think that's all. Thank you for Dr. Sirinan, Professor Lazuardi, all of committee and participants for attending today's international webinar. Before I end the session, on behalf of Faculty of Veterinary Medicine, Universitas Airlangga, I would like to give our highest appreciation and also hand over the certificate to both of our remarkable speakers. Okay, for the first one, certificate will be presented to Dr. Sirinan Pisamai, Doctor of Veterinary Medicine, Doctor of Philosophy from Faculty of Veterinary Science, Chulalongkorn University, Thailand. And also the second certificate present to Professor Dr. Muhammad Lazuardi, Doctor of Veterinary Medicine, Master of Pharmacy from Faculty of Veterinary Medicine, Universitas Airlangga. Okay, thank you very much to both of our speakers. And now the first plenary session is finished. Personally, I would like to say thank you to our speakers and all of the participants. Thank you for joining us today. I do apologizing if there are any mistake or technical problems during this session. Therefore, I would like to hand over back my duty as moderator to the Master of Ceremony, Dr. Dian Ayu. Thank you. Hopefully all of you will be receive many new insight and have a great day. Good morning. Wassalamualaikum warahmatullahi wabarakatuh. Thank you.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you so much, Dr. Aditya, for guiding this session. And thank you very much for the speakers for informative and insightful presentation. For the plenary session 2, will be guided by our moderator, Dr. Adiana Mutamsari Witaningrum, Doctor of Veterinary Medicine, Master of Veterinary. Before we start the plenary session 2, I would like to read briefly about the curriculum vitae of Dr. Adiana. Okay, Dr. Adiana is one of the lecturer in Department of Veterinary Public Health, Faculty of Veterinary Medicine, Airlangga University. In 2010, she has received her Bachelor of Veterinary at Faculty of Veterinary Medicine, Airlangga University. In 2011, she has received her Doctor of Veterinary Medicine at Faculty of Veterinary Medicine, Airlangga University. And in 2013, she got her Master of Veterinary in Disease Science and Veterinary Public Health at Faculty of Veterinary Medicine, Airlangga University. And for publication, she has published 21 papers, Corpus Index, and 143 citations. That is the curriculum vitae from Dr. Adiana. And please welcome Dr. Adiana.
Okay, thank you, Dr. Dian, for the introduction. Good morning, everyone. Assalamualaikum warahmatullahi wabarakatuh. Ladies and gentlemen, I'm Adiana Mutamsari Witaningrum. It is my pleasure to be a moderator for this session, and welcome to international webinar with the theme current update in veterinary science from the bench to clinical application in plenary session 2. I will announce to participant in your Zoom control panel, you will have chat box and Q&A box. For general question related with this program, please put your question in chat box. But for question related with the presentation, please put it on the Q&A box. In this plenary session 2, we have two distinguished speakers. These two speakers are Professor Muhammad Zamri Saad, DVM PhD, from Department of Veterinary Laboratory Diagnosis, Faculty of Veterinary Medicine, University Putra Malaysia, Malaysia. And the second, Professor Dr. Mitsuhiro Takagi, DVM PhD, from Laboratorium of Theriogenology, Joint Faculty of Veterinary Medicine, Yamaguchi University, Japan. Without any further ado, let me start the first speaker in this session. Before that, I would now like to introduce our first speaker. Our first speaker is Professor Muhammad Zamri Saad, DVM PhD, graduated Doctor of the Veterinary Medicine from University Putra Malaysia and doctoral degree from Liverpool. His research area is ruminant disease, fish disease, experiment animal model disease, and toxicity trials. And his publication is 137 papers. And he is also actively some personal duties. He will deliver to the topic for today's presentation entitled Research in Veterinary Pathology from Bench to Consumers. Ladies and gentlemen, please welcome Professor Muhammad Zamri Saad, DVM PhD. For Professor Zamri, you have 50 minutes presentation, and this time for yours.
Okay, thank you very much, Chairman. Let me share. Where is it? How can I share this one? Can you see?
Not yet for PowerPoint, Professor.
Not yet.
Still, yeah, already.
Oh, I have to share again.
Yes.
So can you see?
Yeah. Now we can see.
All right. Okay. Thank you very much, Chairman. Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. First of all, let me thank the Universitas Airlangga Faculty of Veterinary Medicine for allowing me to discuss some issues in veterinary science. I've been given an issue on veterinary pathology. So I choose a title of Research in Veterinary Pathology from Bench to Consumer. I do hope that the content of this presentation fulfill the bombastic title of this presentation. Okay. Right, let's start by reminding ourselves about veterinary pathology. Veterinary pathology is about study of animal diseases. I think many people know about this, particularly on the pathogenesis of animal disease or on the disease development of certain animal disease that you are interested in. So veterinary pathology mainly is about study on the pathogenesis of whatever disease that you are thinking of. As far as our region is concerned, the Southeast ASEAN region, research in veterinary pathology have started long time ago. And since then, it has evolved tremendously in the last 50 years. For example, in the 1960s to 1970s, most of the research were involved in the gross and histopathological description. They were trying to describe what are the changes, gross changes in the organs, as well as histopathological lesions in the various tissues using H&E staining. However, after that, in 1980s to 1990s, when electron microscopy is made available in most of the research institutions in this region, then we start our research describing the astrostructural pathology, in which we describe the detailed changes in cells up to the organelles level in the affected cells. At the same time, we start to use some immunohistochemistry techniques, for example, immunoperoxidase or immunofluorescence, and some other techniques, in which these techniques being used to detect the presence of pathogen or even the distribution of this pathogen within the tissues or within the host. However, in the recent years, in the 21st century especially, we start to use some molecular pathology. Some have been described by our first presenter, in which we study the up regulation and down regulation of certain genes or certain biomarkers that we believe to be involved in disease development. So those are how research in veterinary pathology have evolved from the gross pathology and brief histopathology to the very detailed ultrastructural as well as molecular pathology. So now molecular pathology has become the most recent way of studying veterinary pathology and animal diseases. Therefore, please remember that research in veterinary pathology is actually a fundamental research. Veterinary pathology mainly fundamental research, which is done for the better understanding of the host response to disease development or in disease development. And this understanding or these findings from research in veterinary pathology are quite useful in mainly two areas. One is in developing a better diagnostic technique or diagnostic procedure. The other one is useful in formulating formulating control measures or control of animal diseases, which I'm going to discuss with you further later. Right. So as far as this presentation is concerned, there's only one simple objective, which is to discuss the outcomes of research in veterinary pathology using pneumonic mannheimiosis, or previously known as pneumonic pustulosis, as an example. So in UPM, we have done research on pneumonic pustulosis for quite a long period of time. We have some experience in studying this disease, and some research outcomes that we believe to be important that probably can be shared here for the benefit of researchers in veterinary pathology or in disease pathogenesis or disease development. Okay, so to begin with, let us consider disease, concept of disease or the ideal disease. In general, a disease, the ideal disease should have an agent or agents in which this agent should be able to produce lesions in the various organ or in the targeted organ or in the targeted cells or targeted tissue. And once the lesions being produced by the agents, it is being translated in the clinical signs. The animal will show clinical signs because of the presence of lesions that leads to the failure of the organ functions. And this lesion is caused by the agent. So agent in a disease, there must be an agent, and this agent should be able to produce lesions. And this lesion will be translated into clinical signs. Then you will say that an animal has a disease because the animal shows clinical sign. And agents, there are many types of agents that we know: bacterial, infection, virus, parasite, nutrition, genetic, environment, chemical, and many other things. And of course, when you talk about lesion, you are talking about pathology. So pathology is about studying lesions or host response to the invasion by the agent. And pathology, we have many types of pathology: anatomic pathology, clinical pathology, molecular pathology, ultrastructural pathology, and of course, they show clinical sign. In many instances, we do have agents. Some are known pathogens. However, these agents, they may be present in the host or in the animal, but they are unable to produce lesions. They are present but unable to produce lesion. So in such a case, we call those agents as normal flora. So it is not impossible for you to isolate, let's say, pathogenic bacteria in the nasal, on the nasal mucosa of certain hosts, but those agents or those bacteria are not producing any lesion. So those are known as normal flora. In some instances, agents do produce lesions in the host. However, the lesion is not extensive enough to cause clinical signs, so the animal will not show any signs of being infected or having diseases. So in that situation, we call subclinical infection. So lesions are there, but unfortunately, the animal do not show the sign. So meaning that even though the lesion is present, the organs still functioning, then the animal is not showing signs of disease. So in those instances, we call subclinical infection or no disease. However, you must remember that when you are dealing with agent that leads to lesions, and lesions cause clinical sign, we are dealing with the pathogenesis, how an agent actually leads to the disease formation. So this is called pathogenesis. When we are a veterinarian, we are working, we work at this end in which we will be presented with animal with clinical sign, and we need to determine where the lesions are before we do some lab work to know what's the agents like. And this working this way, we call it diagnosis. So now, as far as veterinary pathology is concerned, we are talking about study of pathogenesis of disease, especially the host response to the infection. Now let's talk specifically about pneumonic mannheimiosis and an example that I would like to discuss with you in this presentation. If you remember the concept of disease, agent, lesion, and clinical signs, in this case, the agent is caused by Mannheimia hemolytica. Pneumonic mannheimiosis is caused by Mannheimia hemolytica. Before this, it is known as pneumonic pustulosis. It is caused by Pastula hemolytica. Now Pastula hemolytica, they have changed to Mannheimia hemolytica. And this agent, Mannheimia hemolytica, caused some lesions in the respiratory tract, especially the lung, that I'm going to discuss with you later. And because of lesions in the lung or in the respiratory tract, the animal usually shows signs of respiratory distress. However, let us start describing this disease by looking at the agent itself here. We look at the agent first before we look at the lesion. So let's go to the agent. When we talk about the agent, we are talking about interactions between the agent itself with the host, interaction of the agent with the environment, interaction of environment with the agent, interaction of environment with the host, and the host with the two factors, agent and environment. So we know that Mannheimia hemolytica, from our study, the serotypes that usually involve in pneumonic mannheimiosis of small ruminant, goat and sheep, is usually caused by Mannheimia hemolytica serotype A2. 80%, 70 to 80% of cases of pneumonia, pneumonic mannheimiosis in goats and sheep is caused by serotype A2. About 10% caused by A7 and another 10% by A9. Other serotypes very, very rarely cause disease in goats and sheep. And not surprisingly, that Mannheimia hemolytica, we can find these serotypes or organism as a normal flora in the nasal mucosa of many goats and sheep. So animals, they are normal, they are healthy, but they carry Mannheimia hemolytica in their nasal mucosa without producing any lesion or any disease. However, when the agents interact with the environment, especially environmental stress, for example, in this case, transport stress, weather stress, for example, especially rainy season in our country, overcrowding, malnutrition, this stress will actually transform the agent on the nasal mucosa from the normal flora non-pathogenic to become pathogen or pathogenic. So these stress factors actually transform the normal flora to become pathogenic Mannheimia hemolytica, and they allows the colonization of this pathogenic organism onto the nasal mucosa of animals. So what happened that when there is transformation of the agent is able to produce toxin. We call it leukotoxin. And this leukotoxin will interact with the host cell in the sense that they will reduce the efficacy of phagocytosis and killing of Mannheimia hemolytica by the leukocytes in the lung, especially the neutrophils and the macrophages. They are found in the lung. They cannot actually completely kill, phagocytose and kill Mannheimia hemolytica, so that many of the Mannheimia hemolytica cells will be available within the lung of the host to produce lesions or to cause damage to the lung of the host. So interactions of host and agent actually is a battle between the host and the agent. And this battle is greatly influenced by the environmental factors or environmental stress. And because of the influence of the environmental stress, it enhances the host susceptibility to infection by Mannheimia hemolytica. So in other words, environmental stress has a great influence on the host in the sense that it will enhance the host susceptibility to infection by the agent. At this particular moment, we know that if we can control the stress and if we control the concurrent infection, which is some concurrent infection may affect the host and enhance the opportunity of Mannheimia hemolytica to infect the host and produce lesion. We have some studies on the possibility of hemoncosis, concurrent infection of animal, goat with hemoncosis that enhance the ability of Mannheimia hemolytica to infect the animal. Similarly, some bacterial infection in the host simultaneously or concurrently infecting the animal together with Mannheimia hemolytica, it leads to better chances of this organism to cause infection of the host and leads to production of lesions. This is an example of how transport stress can influence the normal flora of animals. We have students studying this effect of transport stress. You see, this student, he moved a group of animals, goat, for a total of 250 kilometers using lorry to our experimental station. Upon arrival at week 0, we can see that most of the animals carry normal flora, non-pathogenic Staphylococcus, Streptococcus, and Neisseria here. And none of the animals have Pasteurella or Moraxella. You know, Pasteurella can cause this disease, pasteurellosis, whereas Moraxella can cause eye infection. So at the beginning, after transport stress, none of the animals having Pasteurella or Neisseria or Moraxella. However, 1 week later, many animals start to show or start to carry Moraxella organism as well as Pasteurella organism. At the same time, the number of animals carrying this normal flora, staph, strep, and Neisseria have reduced. And it further reduced in week 2, whereas for the pathogenic organism, further increased in the number of animals carrying this organism until week 4 or week 5, before the normal flora recover back, while the pathogenic organism either start to decrease or remains in the nasal mucosa. Whatever it is, you must remember that once you stress the animal, it is very likely that within the next 4 weeks or 1 month, the animal is susceptible to infection, either by pasteurellosis or by eye infection by Moraxella organism. So 1 month post-stress is very critical for the animal to survive infection, because infection can happen at any time after the stress, after the transport stress, and it may last up to 4 weeks. So if the infection occurs around this area, then many animals will die of this disease. In fact, in this study, we realized that 30% of the animals that have been under transport stress eventually died of pneumonic mannheimiosis after 2 months of arrival to our experimental station. So it is a very, very critical period as far as the normal flora is concerned following transport stress. So this period is actually very critical. When we talk about infection, once the organism, Mannheimia hemolytica, is able to colonize the nasal mucosa, they will eventually proliferate, establish themselves in the nasal on the nasal mucosa before it's being inhaled into the lung. So while they are colonizing the nasal mucosa, they cause only mild rhinitis. You can see here is a layer of of epithelial cells with infiltration of inflammatory cells within the subepithelial layer. Quite a mild rhinitis, in which sometimes the owner fail to realize that the animal actually having mild rhinitis. In fact, this is the beginning of the infection, where colonization of the nasal mucosa has occurred, and the organism is now proliferating themselves before they enter the lungs of the animal. However, once our experimental infection says that once the organism Mannheimia hemolytica enter the lungs, they cause two outcomes. The first one, if the infection is without stress, then the pneumonic lesion is less extensive. It involves only the apical lobe of the right and the left lung. So usually, without stress, they cannot really cause a very extensive kind of lesions. It will affect only a small portion of the lung. Compared to the cases in which there is stress, or there are stresses being put to the infected animal, the pneumonic lesions are usually very extensive. Like in this case, it's involved almost 80% of the lung. So the dark red discoloration are an indication of severe pneumonia caused by pneumonic mannheimiosis. Only a certain portion of the lung remains normal. So this extensive lung lesion develop following stress being added into the infected animal. So you can appreciate how stress plays a major role not only in colonizing of the nasal mucosa to start the infection, but also in the subsequent damage of the lung following colonization of the nasal mucosa. So stress factor is extremely important. Once there is infection, let's say a minor or a mild infection of the lung, it will result in the significantly less severe bronchopneumonia, in which most of the animal might recover from lesions like this. They may be inactive for a while with a mild inflammatory reactions, but eventually they will recover. This is the cases without stress. However, cases with stress, they will lead to very, very severe and extensive pneumonia. The inflammatory cells fill almost the entire sections of the lung. There is hardly any gas exchange that can be able to happen or to occur in lung like this. And of course, the animal usually die because of the lesions, extensive lesions like this. From our study using immunoprocedures, we realized that Mannheimia hemolytica infects only the lung of the animal. They are not present in other organs, liver or kidney, for example, or spleen, or some other organs. They are only present in the lungs. So we can conclude from our study that stress factors plays an important role in colonization of the nasal mucosa, as well as the extent of the pneumonic lesions in the lung. And at the same time, they only destroy or they only cause damage to the lung of the animals, nowhere else. Okay. So once you have a host that's being able to infect the animal, the host will produce very extensive lesions. And of course, because of that, there will be clinical signs. Clinical signs, unfortunately, in cases of mannheimiosis, there are not much. Some animals show nasal discharge. Some animals have coughing, but these are non-specific to mannheimiosis. Other diseases can also cause coughing and nasal discharge by the animal. However, farmers realize that they only know about the disease once the animal die. So death is one of the important outcome or clinical signs following mannheimiosis. In many instances, death occurs without obvious clinical signs. all clinical signs like this are missed by the farmers. So in our study, most farmers only realize that their animal is having problem once the animal die. So death is one of the important clinical signs of mannheimiosis, although some other signs are there, but they are usually not obvious, or the farmer miss or unable to detect the presence of these clinical signs. They are quite non-specific. Okay, so when you have a disease, when you have agent, lesions, and clinical sign, of course, in this case, the clinical sign is death mainly. So we study the monthly death rate pattern due to pneumonic mannheimiosis throughout a year period in east coast of Peninsular Malaysia. We relate this one with the rainfall. The rainfall is in blue, and the death of the animal due to mannheimiosis in red. You see, in Malaysia, we have two rainy seasons. One is in April to June here, and the other one is between October to December here. So in east coast of Peninsular Malaysia, the rainy season is very, very, very high toward the end of the year compared to the middle of the year. However, when you see the pattern of mannheimiosis, you realize that once there is a rainy season, you can see the increased incidence of mannheimiosis. Similarly, here rainy season, which is very, very heavy rain, and still you can see that the incidence of pneumonic mannheimiosis, death due to pneumonic mannheimiosis, is also high. So it is obvious that rainy season or the weather is very, very important, or very, very closely associated with pneumonic mannheimiosis incidents. Okay, so ladies and gentlemen, looking at some of the results that I have presented to you just now, we can see that there are several important results that should be considered. The first one is that colonization of Mannheimia hemolytica is influenced by the environmental stress, especially rainy season. And colonization of Mannheimia hemolytica is influenced by concurrent infection. For example, hemochromatosis, parasitism, other bacterial infection, concurrent viral infection. So these findings should be understood and should be used by the stakeholders, especially the farmers, to ensure that their animal is ready or do not suffer from infection by Mannheimia hemolytica. So in this case, for example, when we know that the rainy season is coming, we should prepare the animals, because we know that rainy season is a stressful situation for the animal, and we should prepare the animal for rainy season. In the sense that our earlier studies says that when we talk about environmental stress, there must be at least two environmental stresses work simultaneously before the animal can succumb to this disease. For example, if you transport the animal during rainy season, so transport stress is one stress, and rainy season is another stress, then it is very likely that the animal will succumb to the infection. Or if you transport the animal to your farm and you realize that the space is not there, so the animal will be overcrowded. So overcrowding is one stress, and transport is another stress. Then the animal will likely suffer from this disease. Or in cases, in many instances, rainy season will lead to malnutrition, because during rainy season, the dry matter intake of the animal is reduced. Most of the grass are actually wet, so they eat wet grass. Then in in actual fact, they are actually eating less dry matter. So less amount of feed is being given to the animal during rainy season. So malnutrition is one stress factor, rainy season is another stress factor, then the animal will have this problem. So if you know that rainy season is coming, you make sure that the animals is properly prepared, good nutrition is there, ample space for the animal to stay, and all related to that. And similarly, concurrent infection, when you know that rainy season is coming, make sure that concurrent infection is not there. You give the antihelmintic to the animal to ensure that there's no concurrent infection. Give whatever things necessary to ensure that concurrent infection is reduced. So these things should be understood by the farmer, and they should use these findings to ensure that their animal is safe from being infected by pneumonic mannheimiosis. That's one use of findings, research finding for the stakeholder here, in this case for the farmers. Second one, mannheimia hemolytica infect only the respiratory tract, leading to severe bronchopneumonia and damage to the lung. They are not going anywhere. They are not a systemic infection. They're just a localized infection, infect only the respiratory tract. So this finding should be analyzed by immunologists or by those who are involved in vaccine development, so that they should find a way to enhance the mucosal immunity or the local immunity of the respiratory tract. Sorry. So that the organism cannot colonize the nasal mucosa or the respiratory tract, and the establishment of the infection in the respiratory tract is being inhibited following enhancement of the local or mucosal immunity. So if the infection is causing septicemia or extensive lesions in other organs as well, then you cannot rely on the local immunity alone. You have to rely on the systemic immunity. However, in this case, it only affects the respiratory tract, then local immunity is important. Regardless how you want to enhance the mucosal immunity, either mucosal immunity alone or the systemic immunity that eventually leads to the enhancement of the mucosal immunity of the respiratory tract. But whatever it is, the enhancement of the mucosal immunity of the respiratory tract is important in preventing the establishment of infection. So these are at least two factors or two findings that should be used by the stakeholders, in this case farmers and researchers, to influence or to come up with a better diagnostic test or better control measures. Okay, so having said that, knowing that how the animal is being infected and how the pathogenesis happen and what influence those pathogenesis, I must mention a bit about the disease control. From the basic pathogenesis research that I've shown you on pneumonic mannheimiosis, we realized that control of pneumonic mannheimiosis, we need to reduce the susceptibility of host to infection. We need to reduce susceptibility of host to infection. Please remember that before the interaction between the agent, host, and environment eventually leads to increased susceptibility of host to infection. That's why the host succumb to the infection. However, in trying to control, we need to reduce the susceptibility or increase the resistance of host to infection. That's one thing. And this thing, to reduce the susceptibility, can be done by several ways or several factors. Number one, we can control the environmental stresses. Like I mentioned before the rainy season, prepare yourself or prepare your animal so that the susceptibility of host is reduced tremendously. Or in other words, you try to prevent establishment of infection by controlling the environmental stresses. Or you can eliminate concurrent infection, knowing that rainy season is coming, then give a proper herd health protocol. You give anti-hemolytic drug, for example, prepare the animal, you cuci kandang, you clean the pen, and so on, so that you actually reduce the chances of infection to happen in your host or in your animal. You must remember that to control environmental stress is very difficult, very, very difficult. Eliminate the concurrent infection is possible, but quite difficult. Usually people would prefer enhancement of the mucosal immunity of the respiratory tract of the host, meaning that you give vaccines against this infection. So that by giving vaccines, you are actually enhancing the immunity of the host, so that you reduce the susceptibility of the host to the infection, or you increase the resistance of the host to the infection. So so vaccination is important for you to enhance the mucosal immunity, or to enhance the immune system of the animal, so that they are resistant to infection. Okay. This is a study in which we expose goats to vaccination. In this sense, we expose goats to pathogen, kill pathogen of Mannheimia hemolytica, and we study the concentration of Mannheimia hemolytica in the nasal mucosa of animals. You can see here that those animals that are being exposed to pathogen, or other word, animals that are being vaccinated, they have a very low concentration of Mannheimia hemolytica in the nasal mucosa, or on the nasal mucosa, compared to the animals that are not being vaccinated, are not being exposed to the antigen. You can see that in general, the concentration of the organism Mannheimia hemolytica is significantly high in this animal, and because of this, the chances of this animal to succumb or to have infection by Mannheimia hemolytica is significantly greater than those that has been vaccinated. Okay? So vaccination, among other things, reduce the concentration of the organism in the nasal mucosa to begin with, so that less number of organisms actually enter the nasal cavity, as well as entering the lung of the animal. So the chances of infection is much less than those not being vaccinated. One of our field studies involving vaccination of goats, pre-rainy vaccination, meaning that before rainy season, we give animal vaccine. If you remember my earlier graph, our rainy season is between October to December, and between April to June each year. So here is the end of the year rainy season. This is the middle of the year rainy season. You can see vaccination, we give it here. Before vaccination, you can see as the rainy seasons there, you can see high mortality. Here another peak, and you have another mortality. But once we give vaccination in September, before rainy season in October, you can see that the rain still same, but the incidence of the mannheimiosis is greatly reduced throughout this 2 years study period. So we give vaccination in September and give another vaccination in March, 6 months apart, another one in September the following year, and March the following year. And we realized that only a few of the animals die because of mannheimiosis compared to the period before vaccination is introduced. So from our study, we would like to suggest that perhaps vaccination, pre-rainy season vaccination, could be one of the answers for us to control pneumonic mannheimiosis. So I hope you can appreciate how early research in the veterinary pathology as well as pathogenesis of the disease can eventually come up with a schedule or a program of disease control. Okay, ladies and gentlemen, in conclusion, I have only two here for you to take home. One is that research on disease pathogenesis enhances the understanding of the disease development. One of the area in disease pathogenesis is veterinary pathology. Of course, there are many other areas, clinical pathology, for example, or study of the agents. However, research on disease pathogenesis enhances the understanding of disease development, and this research actually must be done for you to understand all disease of interest. Do not just jump into conclusion or jump into the control or treatment before understanding the disease diagnosis. Because once you understand the disease diagnosis, then it is clear for you or easier for you to identify at which point that you want to intervene, either through vaccination or other control measure, or where or when can you take sample for a proper disease diagnosis. So disease pathogenesis or research in the disease pathogenesis is very, very crucial fundamental research that eventually enhance your understanding on the disease development. And understanding of disease development helps formulating disease control and disease diagnosis. So only once you understand the disease development that you can eventually formulate the vaccination regimen or the control measures, what to do, when to interfere, and things that you need to do. So my suggestion is that all disease should be studied, especially on their pathogenesis, as a fundamental research before you start to think about what to do with that disease in trying to control or in trying to diagnose the disease. So, ladies and gentlemen, those are the things that I would like to discuss with you. I would like to end my discussion now. Thank you very much.
Okay. Thank you, Professor Zamri, for your interesting presentation. That's gain our knowledge. And now Indonesia is a rainy season, so we must maintain our animal. Okay, and I would like to ask you if this session will be continued to another speaker. Is it okay?
Okay.
Thank you very much. And now for answer the question to Professor Zamri will do in the discussion session later. And now I will continue to the next. Submit your question through the question and answer panel on your attendee control panel. And again, don't forget to indicate your question is addressed to Professor Zamri or Professor Takagi. Let me continue to our second speaker. Our presenter we will deliver. The speaker is Professor Dr. Mitsuhiro Takagi, DVM PhD. He is Professor Veterinary Genology from Joint Faculty of Veterinary Medicine, Yamaguchi University, Japan. Professor Takagi research interests about effect of dietary contamination by mycotoxin on the reproductive performance of breeding cows. And he also actively produce many international scientific papers. In this lecture, in this presentation, Professor Takagi will deliver to topic entitled reproductive disorder in large animal, hormonal genetic deficiency, microorganism infection, metabolic disorder, And ladies and gentlemen, please welcome Professor Dr. Mitsuhiro Takagi, DVM, PhD. For Professor Takagi, you have 50 minutes presentation time, and time is yours.
Thank you very much, Chairman. And first of all, I would like to express my sincere gratitude to the Dean and all the staff of Ariranga University involved in holding this seminar for giving me such a great opportunity. Today,
Sure.
さっき出したのどれですかね。これですか。これですかね。さっきダウンロードしたの。Okay. Can you hear me? Oh, yeah.
Yes, we can
yeah,
see
okay.
it.
Very sorry. Yes, I would like to start my presentation. And my friend, the Oki-san from the Ariranga University, gave me very excellent titles for me to present. But it is very tough for me. That's why I'd like to change the titles. So this is my real title, General Review of the Mycotoxins in the Dietary Feed of Cattle. Also, firstly, I would like to make my self-introduction. I graduated at the Kagoshima University, and also now I finished the PhD course of the Yamaguchi University. And after that, I moved to the Obihiro University, and as an assistant professor, and again moved to the Kagoshima University as an associate professor. And now I'm collaborating with Professor Yamato, maybe you know the Kagoshima University. And after that, I moved to the Yamaguchi University 5 years before as a professor of the cellulogenology. This is my hobby. You know, I was belonging to the rowing team of the university rowing team. And yeah. Yes, and today I would like to present. This is outline of my presentation. And firstly, some basic information about the mycotoxins. And then I would like to introduce our recent research, one of our recent research in the field. This is the, if we culture the piece of the feed on farm, you can see this is PDA potato dextrose alga, and you can see so many mold fungi. This means the feed was contaminated by the fungi. And from the regarding to the mycotoxin relation between human, animal, and mold, yeah, we have two aspects of the some relations. One is, you know, the positive aspect, fermented food. You know, as you know, we can't live miso, soybean sauce, and sake. Yeah, we Japanese like this kind of feed very much, and also antibiotics. You know, like penicillin, very famous. And another one is enzyme preparations, amylase, protease like this. This is from fermented food, or you know, kind of the positive aspect. On the other hand, these are the negative aspects of the fungi mold. Lot of food, pathogens of crop and plants, and pathogens of human and animals. We call mycosis. And finally, poisoning of human and animals as a mycotoxin. So what is mycotoxin? Mycotoxins are secondary metabolites produced by the fungi mold that cause a toxic response, mycotoxicosis, when ingested by human and animals. Consumption of the mycotoxin contaminated diet may induce acute or long-term chronic effects, resulting these reduced growth efficacy and reproductive rates, impaired resistance to infectious disease, induced pathogenic damage to the organs, and sometimes cause culling or death. So this is another clinical aspect of the mycotoxins. The one is, the identification of mycotoxin in the feed of animals by analytical technique, including now we can measure mycotoxins by immunoassay or chromatography. And the identification sometimes difficult and is usually expensive, even in Japan. Identification of the fungi by culture and of the suspect feed required special lab service. But this is very important point that important to realize that isolation of the non-toxigenic fungi does not provide a diagnosis of mycotoxins. This is very important. And Japanese climate seems to be suitable for the fungi growth. And also recently the global warming, in Japan, very problem. We have very problem for the during the feed storage, and possible to expand mycotoxins contamination due to the international feed trading. This also now very problem. And mycotoxins contamination of imported grains during the storage period. These are now monitoring of mycotoxins by national feed inspections in Japan. But information is not available on farm condition, real farm condition. Very difficult to monitor the mycotoxins after the imported, and difficult to analyze mycotoxins on farm conditions, and difficult to diagnose of mycotoxin in farm. So, and also this is one example that, how difficult to monitor the mycotoxin level in the feed. If we measure that some kind of nutrition, such as protein, and this is some piece of the feed, we can take as a samples anywhere, because the protein usually contain evenly, but on the they said kind of spot-like exists. So if we take samples from here, we can't detect mycotoxins, but mycotoxins here. So this is some problem to measure the mycotoxin from the feed. So on the other hand, I would like to explain the types of mycotoxins. Now, mycotoxin comprise more than 300 different chemicals that cause a variety of clinical symptoms. And there are three main fungi that produce mycotoxins. The one is Aspergillus flavus. Aspergillus toxins. For example, Aspergillus flavus is very important, very famous mycotoxins. aflatoxin B1, G1, M1, etc., and hepatotoxicity and cell toxicity and DNA damage, very famous one, maybe you know very well. And the second is penicillium toxins, ochratoxin and patulin. And third is fusarium toxin, fusarium graminearum, like this. For example, zearalenone and DON, deoxynivalenol, or monicins, three major types of mycotoxins. This is the picture of the Aspergillus flavus. You see like this, and the colony like this. These very typical figures, very easy to identify. And this is Penicillium expansum. This fungi produce the patulin, and as you know, this is a cultural dish, and you can see the blue colors. And as you can see, this is typically a Penicillium species, like a broom-like shape, very easy to identify. And this is the third one, is fusarium. Usually fusarium called pink-red fungi. So when we culture, you can see this pink-red colors, and the shape is crescent moon-like shape. You can easily identify. And in Japan, we have Japanese regulations for feed safeties, and now we have DON, deoxynivalenol, zearalenone, and finally aflatoxin B1 was regulated, and criteria is one, in case of DON, 1 ppm, zearalenone 1 ppm, and aflatoxin B1 is 1 ppb, more strictly regulated, of course. And recently, the fumonisin was also included in these regulations. So I'm now research about zearalenone, especially because I belong to reproduction. Fusarium species is the the fact is zearalenone. The fusarium is a field fungi infecting maize, wheat, barley, rice, and other cereals. Zearalenone then is a non-steroidal estrogenic mycotoxins, which is produced predominantly by Fusarium graminearum. And the concentration of Zen in feed and feed vary depend on the climate conditions, and the highest rate of the contamination of feed and feed samples occur in years with heavy rainfall in spring and summer. And this is very, very much to the Japanese climate. So I'm very interested in how is the now situation in the contaminated situation in Japan, and how the effect for to the reproductive function of the cattle. So as I mentioned, zearalenone is non-steroidal estrogenic mycotoxins, and as you can see, this is the structure of the zearalenone, and this is estradiol. They're similar structures and very easy to bind to the estrogen receptor. That's why estrogenic and anabolic properties affect the reproductive system. Zearalenone is so-called endocrine disruptor. So, how is the reproductive toxicity of zearalenone in domestic animals? Now, I'm now researching. The most important symptom is hyperestrogenism, swelling of the vulva, hypertrophy of uterus and vulva, vaginal discharge and ovarian atrophy, and also a prolonged estrus, and finally, decreased fertilities. And to evaluate zearalenone for the reproductive activity, I'm now very much interested in to measure the anti-mural hormone in female cattle. So what is anti-mural hormone? AMH is the glycoprotein produced by the granulosa cells of follicles. You know, this is a figure of the granulosa cells. This is oocyte, and this is granulosa cell, and the basement membrane, and the outer side is the Seca cells. Usually, the granulosa cell secrete the AMH from the very healthy follicles. And inhibit the recruitment of, this is some explanation of AMH, inhibit the recruitment of primordial follicles into the pool of growing follicles, and decrease the responsiveness of growing follicles to FSH. So this is AMH affect to control the follicular selection right now. Yes, and now AMH is the best endocrine markers of the populations of small antral gonadotropin responsible follicles in cow. So now the AMH is a kind of the marker for the good, how to say, reproductive efficacy of the cattle. And on the other hand, in vitro studies reported that zearalenone induce apoptosis of granulosa cells in the antral follicles, leading to reduced AMH secretions. And this is the kind of the point. And we already reported that zearalenone and its metabolites are detected in bovine follicular fluids. We reported 2008. This means maybe the zearalenone will affect to the follicular development. As I mentioned, in the follicular fluid, zearalenone exists. So if this zearalenone affect to the granulosa cells, maybe AMH secretion will decrease, and finally, the follicles will become athletic. So now we are now research about this kind of studies, some relation, zearalenone contamination and some reproductive efficacy of the cattle. So and another aspect, control of mycotoxins. Most of the control method of mycotoxin identified below at a trial level and have not been used widely. One is the spraying of a pasture with fungicide, but it's very difficult. It seems very difficult. And the second, immunization animals against some mycotoxins. Also, I think very still difficult and not popular. And now, adding adsorbents into the feed, such as activated charcoal, bentonite, and zeolite is the most popular method to prevent the mycotoxin contamination of the animals. So now we are very focused on the first is the effect of gene to reproduction and metabolism, in vitro culture, hormone assay, and metabolomics, etc. And secondly, how to control for chronic contamination of feeds, avoid disruption of intestinal barrier function. These are now our research titles now going on in my laboratory. And I would like to introduce one of our recent research, which was presented at the World Boatrix Congress in Sapporo 2018. The title is Supplementation of DFS3 Reduced Mycotoxin Absorption in Cattle by Modifying the Tight Junction Network. So this is the introduction. First, introduction. So as I mentioned, what are mycotoxins? As I mentioned, secondary metabolites produced by fungi, and cause of toxic response, mycotoxicosis, when ingested by human and animals. And consumption of mycotoxin contaminated diet may induce acute or long-term chronic effect, as I mentioned before. And intake of mycotoxins has been associated with reduced productivity and residues in food products. This is now very problem. So what is Zearanon? As I mentioned, same thing. In the past few years, we have been focused on the mycotoxin Zearanon and its metabolites to examine the natural contamination status in farm environment. Zearanon, because non-steroidal estrogenic mycotoxin, endocrine disruptors, and mainly produced by fusarium, as I mentioned, like this, because due to the very easy to bind estrogen receptors. So if the Zearanon orally intake, absorption from the intestine, and Zearanon, there are mainly two pathways, alpha and beta pathway. And this alpha pathway is mainly, for example, swine, pig pathway, and this beta is in case of cattle pathway. And finally, some metabolites for these parents mycotoxin enter the bile and enter the enterohepatic circulation. And mainly, these parents mycotoxin and metabolites secretion into the urine samples. So background of this experiment, establishment of urine Zearanon concentration measurement using the LC-MS method we already reported. So with this method, urine then monitoring system monitor Zearanon and its metabolites in urine is useful tool to predict animal exposure, not feed samples. And also monitor then and its metabolites in urine is a useful method to evaluate the effect of mycotoxin absorbance, added as a supplement to daily feed rations. We use this method to identify the effect of the mycotoxin adsorbent. And we use this materials, DFS3. So what is DFS3? Non-digestible disaccharide present in the commercial roasted chicory. this DFA3 promote iron absorption from the intestine in rats, human, and cattle. They already reported. And useful feed supplement as prebiotics for the improvement of intestinal microbiota, the health in cows. We already reported of the useful for the health condition for the cattle as a prebiotic. So we use this DFA3. And very recently, it was reported that demonstrated a direct interaction of this oligosaccharide with intestinal epithelial cells. And they showed that OSS improve and protect the intestinal barrier integrity and moderate the immunoresponse of epithelial cells. Thus, administration of DFA3 may improve and protect the intestinal barrier integrity in cattle, thereby mitigate the adverse effect of chronic exposure to low-dose mycotoxin contamination of cattle diets. This is our hypothesis. So objective of the field study is firstly, evaluate the beneficial effects of the supplementary DFA3 on the intestinal barrier function in cattle by monitoring the urinary zinc and its metabolites in cattle herd, and analyze of serum concentration of calcium, inorganic phosphate, and also magnesium as an indicator of optimal function of the intestinal epithelial cells. And finally, evaluate the possible beneficial effect of DFA3 as feed supplement in cattle exposed to mycotoxin using zearalenone as an example. We used 2 Japanese black female cattle herd, totally 30 heifers. And this is DFA3 group and control group. We supplemented DFA3 and control group without DFA3. Very simple. This is protocol, sample collection. DFA3 is totally 15, control group totally 50 heifers. And we collected 4 times urine samples and blood samples. And DFA3 was supplemented for 2 weeks, 14 days. And control groups, no DFA3 supplementation. And we collected the urine samples by massage method. Very simple, very easy. And this is the procedure to manage the samples. Urine samples, we use LC-MS, and urine samples only 0.5 ml. And with the enzyme for extraction of the zearalenone after culture, and I used C18 column, and extraction was conducted, and measure LC-MS. And also we measure the creatinine to modify this zearalenone concentration for the adjustment of each samples from the heifers. This calculation method, final zinc concentration in urine was divided by the creatinine concentration. And also, for the blood samples, we measured calcium, IP, and magnesium. And so this is the result, very simple. And you can see, this is the parent zearalenone concentration during the experiment. DFA3 was supplemented for 2 weeks. And this is alpha zearalenone, and this is beta zearalenone, that some metabolites of this parent zearalenone. And this is total volume of these 3 concentrations. You can see a significant difference between DFA3 and control. DFA3 groups, then zearalenone, its metabolites and beta, alpha, beta, and also the total concentration was decreased, significantly decreased compared with controls. This is a result of the blood samples. You can we could see only the significant difference in case of the PI in organic phosphate at the 23-day 23s, but no significant difference was observed in calcium and magnesium. So maybe this is our hypothesis that if we supplement the DFA3, and this is the epithelial cells of the intestine, and this is blood vessels, and there are two pathways. One is the transcellular transport, and also the paracellular transport pathways. And this small circle is zearalenone. And if we supply this DFA3, this tight junction protein is become more improved, become normal, or to the protection ability of this tight junction was become strong. That's why the absorption of the zearalenone from this paracellular transport was inhibited. Then finally the urine concentration of zearalenone and its metabolites was decreased. This is our hypothesis. So this is the conclusion of the experiment that with DFA3 supplementation, to dietary feed alter zen and ion absorption level in cattle. And our result, the first indication that DFA3 supplementation may reduce the level of the mycotoxins that reach systemic circulation and excreted in the urine. And also, the monitoring urine mycotoxin is useful for the evaluation of this effect of dietary supplementation that may prevent mycotoxin absorption from the intestine. Moreover, DFA3 seems to improve the tight junction dependent intestinal barrier function. So now we are conducting additional research, because we recommended further field studies as well as creation of the database for the assessment of this DFA3 as a dietary supplementation to reduce mycotoxin absorption and to mitigate the adverse effect of the mycotoxins in cattle and other animal species. So that's all. Thank you very much for this opportunity, and I really appreciate the Oki-san from the Ireland University to support me to make excellent slide. Thank you very much for your attention. Thank you very much.
Okay, thank you very much for Professor Takagi. Your presentation is very interesting, and thank you for all speakers, ladies and gentlemen. Now we are going to take a question and answer session. As a reminder, you can still submit your question through the question answer panel on your attendee control panel. So now. The first question is for Professor Zamri Saad. Maybe, sorry, Professor, maybe Professor Zamri already answered the question, but maybe may another attendee or participant not yet to read this question. So, Assalamualaikum Professor Zamri. My question is, how do we know if the fish or aquatic animal are having stress? What are the signs of stress? Thank you.
Okay, thank you for the question. Stress in fish usually comes from the water quality, especially poor water quality, and they usually show certain signs, especially they become inactive, they become inappetent, and shows small lesions on the skin of those animals. So those are the early indication of stress in fish. Of course, after some time, they usually die because of the adverse effect of the stress. Thank you.
Okay, thank you for your answer, Professor. And this is the question from attendee in YouTube. In connection with the development of vaccine against M. hemolytica, what is the most effective way to minimize the colonization of M. hemolytica and enhance the mucosal immunity of the host?
Okay, now there are several vaccines available against mannheimiosis, mostly injectable vaccines, in which animals were injected with the vaccine to prevent infection. Some studies, especially in UPM, we are developing intranasal vaccines in which the vaccine is being given into the nasal cavity rather than injection, because we believe that by introducing the antigen intranasally, you can quickly enhance the mucosal immunity of the animals. So whatever vaccines that you are using, make sure that you use the vaccine before the stressful period. For example, before rainy season or before you transport the animal elsewhere. So those are the critical time for you to use the vaccine.
Okay, thank you for clear answers, Professor. And now from Fatina Bila, salam Professor Zamri. I'm Fatina Bila from the university. I have a few questions for you. The first, how long until the animal show lesion from the moment they are infected by the disease? And the second, is there a way for farmers to detect this disease early, prevent the risk of infection? And the last, is there a possibility for the animal to be infected again even after vaccination? Thank you.
Okay, first question about how long. Lesions usually develop from our experimental trial, experimental infection. Usually, lesion will develop between 2 to 4 weeks after we introduce the organism into the animal's host through the either nasal mucosa or intratracheal injection. So the animal usually will develop lesions within 2 to 4 weeks, but by 4 weeks, if the lesion is without stress, there will be a less extensive lesion. The animal usually will recover after that. But if by 4 weeks there's still stress, then animal will develop very extensive lung damage, and the animal usually will die after that. That's question number one. Question number two about farmers can detect infected animal by looking at the clinical signs, either long forceful coughing, one sign that is indicative of this disease. The other one is purulent nasal discharge is another indication. But those are indication in which farmers need to further confirm by taking nasal swab, and if the result shows high concentration of Mannheimia hemolytica, then likely that the herd is currently having that disease. So look at the clinical sign to suspect, and then nasal swab to see whether the animal is having the disease or not. Number 3, infected. Oh, okay. Once you vaccinate the animal, it depends on the vaccines. Usually, the vaccine will protect animal at between 90 to 95%, meaning that 5 to 10% of the animals still will die because of the disease. However, after the effectiveness of the vaccines subside, then the animal can get again the infection after the vaccination. So that's why we suggest that depending on the type of vaccines being given let's say every 6 months, just before the rainy season. Okay.
Okay, thank you, Professor Zamri, for the answer. And question for Professor Takagi, because his duty, so the question will be collected and sent by email, and the answer will be sent to participant email. So I will continue to question for Professor Zamri. This is from Palagan Sinopati Sewoyo. Assalamualaikum, good day, Professor Muhammad Zamri Saat. I am Palagan Sewoyo from Udayana University, Bali, Indonesia. You have already mentioned that the development of research on pathology has been so rapid. So its initial use of gross pathological and histopathological methods with H&E staining in the 1960 until 1917. So to the use of immunohistochemistry and ultrastructural pathology in the 1990. I want to ask the first, what are the limitations of histopathology today with several other methods that are more accurate and specific in understanding the lesion? For example, proliferation of new blood vessel, neovascularization, require VEGF antibody, which is must use immunohistochemistry. And the second question is, the single use of the histopathological method still relevant in current studies or research without immunohistochemistry, etc.? So thank you, Professor, and your answer, please.
Okay, first question about the limitation of histopathology. There are some limitation of histopathology. It depends on what you want to do or what you want to see the outcome. If you are basically histopathology, H&E is to support the observations during gross examination, meaning that if you have lesions that you can see lesions grossly, you can confirm through histopathological examination, H&E. However, if you are interested in a more detailed changes, subcellular level, of course, the histopathology is not for you to use. You need to use some other method. So histopathology is still useful if you just want to describe what are the changes in the cells of infected animal, to confirm changes that you see grossly. There are some limitations, but it's still useful. Number 2 is about single use of histopathology. It is still relevant because certain disease have produced pathognomonic lesions histologically. For example, certain disease produce certain inclusion body, for example, that's very suggestive or pathognomonic for certain disease. So in such a case, you can use histopathology and quickly diagnose a disease. However, in research, if you use histopathology in research, it will be quite limited in the sense that, like I said before, it just you can just describe the brief changes in the cells. You require some other methods, details method like immunoprocedures or even molecular pathology to describe a more detailed changes. Okay.
The next question from Amir Sesat. My question to Honorable Professor Saad, that subclinical stage of the disease is future hazard and step of outbreak. How by the use diagnostic technique, especially through IgM and IgE in ELISA, we can predict. Is there any role of serological test in future pathogenicity?
Okay. Well, serological test, yeah, that's true in the sense that subclinical infection usually leads to carrier animal. Those carrier animal are actually a source of infection and outbreak of disease. You should identify those subclinical or carrier animal and destroy those animal. And in order to do that, there are several ways in doing so. First is serological test. Using several techniques. What I would like to suggest is that you use a serological test with high specificity. There is ability to detect as many as negative animals concerned, to screen the herd. And once you use that test and you screen the herd, and you can find that some of the animal may show positive results, and those might be a false positive. Then you need to repeat those positive animals with another serological test, for example, ELISA, which have high specificity. High sensitivity, meaning that they have high ability to detect positive animals. So by doing that, you can actually identify animals that are subclinically infected and cull those animals. If you remember your immunology, IgM is usually being produced at the early infection, whereas IgG in the later stage of infection. If you are able to detect IgM, then you should be able to detect early infection in animals. But if your test use to detect IgG, then you should be able to detect infection at later stage rather than early stage. So, however, serological test is commonly used to identify infected animal or subclinically infected animal. Okay.
Thank you for a clear answer. And the last question from Dr. Eka Pramirta Hestiana. Assalamualaikum, Professor Zamri. I'm Eka. My question is, hemolytica infect only the lung that you have mentioned? So is there any damage in the upper respiration tract, especially on its epithelial cells? Thank you, Professor.
Okay. Hemolytica usually cause severe damage to the lung parenchyma. Very seldom they cause severe lesions in the upper respiratory tract. However, they are able to cause mild to moderate necrosis of the epithelial cells of the upper respiratory tract, especially in the nasal mucosa. In our experience, we have never been able to isolate mannheimia hemolytica in the trachea of animal because of, I think, because it has no tropism for the epithelium of the trachea. And the other one is that the rate of air passing through the trachea, I think, is quite high. So the organisms unable to actually attach themselves to the epithelium of the trachea, but they are able to. They are most comfortable in the alveoli of the lungs.
Okay, thank you very much, Professor Zamri, for your answer the question. And now from today, let me try to recapitulate the message from our two distinguished speakers, and I will summarize. The research in veterinary pathological is actually fundamental research done for better understanding of disease development that useful in developing better diagnostic technique and formulating control measure. And the important to clinical aspect of mycotoxin is to realize that insolation of known toxigenic fungus does not provide a diagnosis of mycotoxicity. And thank you for Professor Zamri and Professor Takagi and everyone for attending today's webinar internationals. And before I end this session, on behalf of Faculty Veterinary Medicine, Universitas Erlangga, I would like to hand over the certificate of appreciate to our distinguished speaker virtually. Our first certificate will be hand over to Professor Muhammad Zamri Saad, DVM PhD, from Department of Veterinary Laboratory Diagnosis, Faculty of Veterinary Medicine, University Putra Malaysia, Malaysia. And the second certificate to Professor Dr. Mitsuhiro Takagi, DVM PhD, from Laboratorium of Genology, Joint Faculty of Veterinary Medicine, Yamaguchi University, Japan. And again, I would like to thanks to our speakers and for the participants. Thank you for joining us today, and have a great day. And see you next event. I would like to hand over back my duty to a Master of Ceremony. Thank you. Good afternoon. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you so much, Dr. Adiana, for guiding this session. And thank you very much, speakers, for such an informative and insightful presentation. And we come to the next agenda. For the next agenda is closing remark from Vice Dean in Academic, Student and Alumni Affairs, Dr. Rimayanti, Doctor of Veterinary Medicine, Master of Health. To Dr. Rimayanti, the time is yours.
Thank you, Dr. Dian. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, ladies and gentlemen. First of all, I would like to introduce myself. I am Dr. Rimayanti DVM, as Vice Dean of Academic, Student and Alumni Affairs, Faculty of Veterinary Medicine, Universitas Erlangga. In this very special occasion, I would like to express my thankfulness to our honorable speakers today, Professor Muhammad Zamri Saad from University Putra Malaysia, and then Professor Mitsuhiro Takagi from Yamaguchi University, Japan, and then Dr. Sirinun Pisamai from Chulalongkorn University, Thailand, and also Professor Muhammad Laswardi from Universitas Erlangga, Indonesia. Thank you very much for the important and interesting speech in the international webinar entitled Current Update on Veterinary Science from the Bench to Clinical Application. All of us have obtained a great knowledge and discussion. We have learned a lot from the scientific sessions delivered by amazing speakers who have shared their interesting experience. On behalf of the Faculty of Veterinary Medicine, Universitas Erlangga, and also all of the committee, thank you for delivering such valuable materials so all of us can enhance our knowledge. We really appreciate that, and I hope to have the opportunity to collaborate again in the future. I would like to thank all participants who have joined this webinar. I hope it can gain our knowledge about the current update on veterinary science. Finally, I would like to thank all the committee members for organizing this event and ensuring that it proceeds and running smoothly. I hope we will be able to meet with all speakers and also the participants in the next event. Thank you very much. Good afternoon and wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, Dr. Rimayanti, for the closing remark. Finally, we get to the last session in this event, that is closing. On behalf of the committee, we would like to thank to all the speakers for the informative and interesting presentation, and all participants for the participation. May that we have conducted today will be useful for all of us. And once again, if there are any imperfections during the implementation for this event, we would like to apologize to everyone. Okay, let's close this event by saying hamdalah. Alhamdulillah. Wassalamualaikum warahmatullahi wabarakatuh.